Trying to drop my hand down. Just my right foot. Possibly fit under the end there. Thank you very much. Yes, we resume therefore the debate on P115. Senator Padden.
Thank you, sir. I'll pick up from where I left off.
Indeed.
Since Samurai Ward closed, it's clear from the experience of patients that the amount of consistency of therapy treatments does not meet the national guidelines. And I believe it's unlikely in the confined space that is Plemmoor Ward. The lack of consistent physiotherapy and occupational therapy is not meeting the national guidelines that state people with stroke should accumulate at least 45 minutes of each appropriate therapy every day at a frequency that enables them to meet their rehabilitation goals, and for as long as they are willing and capable of participating. The current limitations on both gym space and basic occupational therapy equipment, I seriously doubt any patient that has been through Plemmoor Ward or are there now are currently meeting this guideline. If space is the issue, and if you had visited both wards as I have, you can clearly see that the simple answer for the short term is to relocate the unit back to Samurai Ward, where all the necessary space, facilities and equipment exists. This would give the island back the first-class facility it had previously and was so proud of. How many patients have had their long-term recoveries damaged by the inability of the Minister and his team to realise that Plemmoor Ward is seriously underachieving when they knew Samurai was perfectly capable of being reopened? Sir, I will remind members again, it's 87 weeks since Plemmoor opened its rehabilitation provision. It's totally unacceptable that the improvement plan outlined by the Minister was only put in place in December last year. The national guidelines also state that multidisciplinary stroke teams should incorporate the practicing of functional skills gained in therapy into the person's daily routine in a consistent manner, and the care environment should support people with stroke to practice their skills as much as possible. Samurai already has the care environment required without the HCS estates team having to carry out noisy and invasive building work in a ward where patients are attempting to rest and recover. This is merely an attempt to recreate facilities that already exist on Samurai in a space that is clearly not big enough. It will also be so much easier for any multidisciplinary team to carry out their coordinated work in our purpose-built facility at Samurai, where space is most definitely not an issue and patients have an environment that's conducive to recovery. Another area of concern to me since the rehabilitation unit was relocated to Plemmoor Ward is that of the mental well-being of patients that have suffered a stroke or serious injury. This will likely mean a huge change in their lives and potentially in their expectations for the future. And it's vital that these patients receive the necessary advice on their mental health. It cannot help that patients on Plemmoor Ward have little or no privacy, are not able to access the peace and quiet that they desperately need, are situated on a ward with toilets that cannot accommodate hoists to assist paralysed or limited movement patients, are on a ward where commodes are used and where there is no access to a dietitian. I could understand how someone could become anxious or even depressed at present, and the environment of cramped wards with beds on top of each other and limited bathroom facilities is not really helping their cause. I have no clear evidence that antidepressants are a go-to cure for medical professionals to treat those who are feeling down or struggling to come to terms with their health issue. But one carer of a patient has reported to me that my partner was offered antidepressants as he was feeling down. Although he has always had very good mental health, coming to terms with becoming increasingly disabled overnight would take its toll on anyone. This stands to reason. He is not clinically depressed. He clearly requires support and guidance, not medication. He has yet to receive any mental health support to come to terms with his disabilities. How is this not provided as standard on the rehabilitation ward, where all patients must surely require the support to some extent? This is a major shocking omission in the support that is available to patients. It is even more shocking still that this lack of effective treatment is being masked by the offer of unnecessary medication. It is clear that HCS pays nothing more than lip service to parity of esteem between mental and physical health. I might also add, sir, that we also received emails outlining the care of other patients on Plemmer Ward that also highlighted this issue, and I quote from another: "It was chaotic. Patients with mental health issues were on the ward, but there did not appear to be any mental health staff or counsellors available on the ward. Some of these had thrown antidepressants into their medication. Yes, antidepressants, as if that was going to solve their mental state. They were in shock, traumatised, had no idea where they were or how they got there. They could not understand what had happened to them. They were paralysed, either in leg, arm or both. Patients were falling out of chairs and beds, and one patient was throwing anything he could get hold of at other patients who were unable to duck or move out of their chair to avoid the item aimed at them. I've never witnessed or imagined witnessing anything like this in my life. My father became a shadow of himself with a belief that this was the end and there was no future." And another simply said, "My primary concerns are the non-existence of mental health care and dependence on antidepressants." Sir, I find these comments chilling to the bone, and I hope members feel the same. I have no explanation as to why antidepressants were apparently used unnecessarily in this way, but it is clear that Plemmer Ward is extremely busy and staff under immense pressure to deliver care to patients with complex needs in a difficult environment and with facilities that are not helping them to achieve the highest levels of care. I have to say that I wasn't aware that such problems existed prior to the move from Samurai Ward, but issues do currently exist that require investigation and attention in the short to medium term. In the short to medium term, in our view, a return to the purpose-built facility at Overdale seems to me to be the only sensible way forward. And sir, that is even if it is only for a 6 to 9 month period while the Minister puts in place a rehabilitation unit that can properly replace Samurai. If Samurai is to finally be demolished to make way for a new hospital. The national guidelines for dealing with patients suffering anxiety and depression as a result of stroke are clear. And yet again, I do not believe the rehabilitation unit on Plemmer Ward are meeting these guidelines. The guidelines state people with one mood disorder, for example, depression, should be assessed for others. It is also stated people with mild or moderate symptoms or psychological distress, depression or anxiety after stroke, should be given information, support and advice and considered for one or more of the following interventions: increased social interaction, increased exercise, or other psychosocial interventions such as psychosocial education groups. Even if patients were assessed as being depressed on Plemmer Ward, there is little opportunity to increase social interaction or exercise, and any such action would require the necessary skilled staff to support the patient. I believe that mental health support is currently at the bottom of the list when it comes to caring for stroke and injury patients, and is yet another reason why patients who require specialist treatment, space to recover, peace and quiet, adequate rest and recuperation, and the right environment to rebuild social contact should be moved back to Samurai as a matter of urgency. My proposition is clear that it is crucial the Minister not only considers how rehabilitation can be properly accommodated in the plans for a new hospital, but he finds without delay a temporary home for rehabilitation services that suits both the clinical needs of the patient and provides an environment to support recovery. I noted in the open letter to States members that the Medical Director and Chief Nurse state that returning to Samurai Ward will be clinically unsafe. But neither in the report to the amendment, the States members briefing, the open letter, or in questions this week, has any clear reasoning been given for this assumption? If the unit was clinically safe previously, then I've been advised that there is no reason that it's not true now. It is impossible to go through all the requirements of the 2016 National Clinical Guideline for Stroke, or indeed the 2013 National Institute for Health and Care Excellence NICE guidelines for stroke rehabilitation, as both set out clear pathways for how stroke units and multidisciplinary teams should be organised. The Minister makes much play in his report to the amendment. The Minister makes much play both in his report to the amendment and the briefing he gave to States members that his department has received only 7 complaints. He has also said to me that he will be happy to receive any complaints that I have received from patients or their families and deal with any issues. In this day and age, in an island with such a huge international reputation, it pains me to say that some patients and their families are scared to make a complaint, as they feel that because they are still being treated, that they will potentially be victimised and their care and support reduced further. I can understand that fear and try to reassure anyone who has asked me that I will ensure they are treated fairly. But for some, the risk is far too great. Some families have been badly let down and have lost faith in a service that should have provided them with the best possible opportunity for recovery, but instead have had them discharged, rushed out the door without the necessary preparation or care packages they need to continue their recovery at home. The Minister has admitted that communication between his department and the public has not been good. That remains the case, and his department have a long way to go before they can convince the public that they are listening to patients and families and prepared to learn from mistakes. The same lack of communication, I believe, also exists between senior management at Health and Community Services and their staff, who, although being in the firing line on a day-to-day basis, do not get the support they deserve from the ever-increasing army of managers that are making the health department too top-heavy. I want to speak about the promotional video that the Minister provided last week and the effect this short film has had on staff. I didn't believe that the Minister would sink to having propaganda films made to attempt to persuade States members to accept his amendment. The meaning of propaganda is clear. It's information, especially of a biased or misleading nature, used to promote a political cause or point of view. And yes, the film is undoubtedly propaganda. We are all politicians, and we each have a right to promote a political cause. But in this case, this is dealing with people's lives, their well-being, and I and others expect the truth to be portrayed in films of this nature and not fiction. I have to say it was cleverly filmed. It's not what is shown that causes me the greatest concern. It's what is not shown, as it's the parts of Plem Award that we don't see that has caused many of the issues highlighted in many of the unacceptable patient experiences that I've already mentioned. We saw the corridor, narrow and very busy and difficult to navigate. If you're in a wheelchair or had problems walking. There were staff on duty who smiled and waved to the camera, although we didn't see much of them engaging with patients, and none of them were interviewed. We were taken into a ward that was partly being used as a gym and saw a table being used for occupational therapy. All very good, but in terms of available space, very limited and unlikely to be able to cope with 14 patients if all were being treated to the National Clinical Guidelines for Stroke. The day after the film was shot, I am told that 21 patients were in need of a rehabilitation. The 5-bed wards had 6 beds in them, and the bay allocated for a dining room had 6 beds in it. We were not shown the wards, and I can tell you why. When I visited, both wards had 6 beds in them. The wards are desperately cramped, and during visiting time, visitors' chairs are back to back with patients and their families having no privacy at all with their loved ones, irrespective of how ill they are. There is one toilet for 6 beds, no storage facilities, and no opportunity to make a patient feel welcome. The most disturbing element of this video was the general ward manager extolling the virtues of rehabilitation being provided to all, yes, all patients, and the statement that the ward only discharge patients when they are ready to go home. This is simply not the case, and it's disgraceful that a manager is being used in this way to portray a service that is underperforming and letting islanders down. I am told by a source that the general ward manager who was seen in the video had never been seen on Plemmer Ward prior to the filming of this video and left soon after. I'm also told that many involved with delivering care were seriously concerned about the propaganda put out in the name of HCS about the rehab unit. I quote from a source. Members of staff were in floods of tears because they cannot believe the pack of lies being told and reporting their management and reporting that management do not speak with them, do not speak with the patients, and simply do not care. The comment went on to say, "This is the most appalling thing this government has ever done, and I don't say that lightly." It's becoming increasingly clear that staff are afraid to speak out. They don't believe that they can appeal to the minister as he simply doesn't listen. I'm being told of the extreme vindictiveness that is meted out to anyone who tries to raise issues or challenges anything. Interestingly, no members of staff were interviewed, as I've said, or asked to comment in this recently produced video, and you can make up your own mind why that is. I've asked sources whether staff will speak to me privately and anonymously, but a response I received said, they, the staff, are so frightened that they would be found and disciplined. Staff are also avoiding social media as sites are being monitored, with managers being overheard discussing how can we get them and discipline to shut them up. They wish they could speak freely, but the place is toxic. The place is full of patients with little or no rehab going on, as reported in the video, and staff feel it's a joke. This situation is such a mess. The response went on. I've met with a health professional this morning. They hadn't seen the video and watched it almost in disbelief. They claim the mood has led to lifelong disabilities that are avoidable. Sir, members can believe or disbelieve the comments I've received from sources within the hospital, but they dismiss these claims at their peril. We have patients that have given clear accounts of poor service that is essentially down to the limited facilities that are available on Plemmer Ward. You've heard the staff share these concerns and are not being listened to. The National Clinical Guidelines for Stroke state, people's perceptions of the quality of care they receive do not always match the clinician's view of the care that they have delivered, and these views need to be separately audited in a manner that enables the participation of those with significant disabilities. Never was a truer word said. The clinician's views and that of the senior manager and the minister are a million miles away from the views of patients and their families. And it's a disgrace it's taken 87 weeks to introduce the necessary clinical audit and an improvement plan to drive a better service for rehabilitation patients. Everyone should be able to participate in feedback, but the views of patients has to be paramount. And if problems are highlighted, they need to be recorded, assessed, and acted upon. And this should not take 87 weeks to set up. I briefly want to touch on capacity and the ability of Plemmer Ward to cope with not only the number of rehabilitation patients that they are currently receiving, but the increased number that are likely due to the ageing demographic in Jersey. My written question 495/2021 asked the Minister various questions around the length of stay of patients in rehabilitation. patient counts each year differed between 158 in 2016 to 252 in 2019. And the average length of stay also varied between 31 days and 42 days. Even if you take a mid-range figure for yearly patients of say 200 and multiply this by the average length of stay of say 34 days, this equates to 6,800 bed nights. Samaray has 27 beds, and even if the ward was operating at say 80% of capacity, this would equate to 7,800 bed nights. Plemmoor Ward, on the other hand, has a 14-bed capacity. And even if the ward was full for 365 days a year, can only offer 5,110 bed nights. Therefore, there is a serious capacity issue on Plemmoor Ward that can only be dealt with in one of two ways. The first would be to increase beds on what is already a cramped and confined ward. This is going to have an effect on the quality of the rehabilitation service, an issue that is already a problem, or there is a risk it will impact on other aspects of acute care in the hospital. The second will involve discharging patients early against national guidelines and in contradiction of the statement made by the general ward manager in the video that patients will only be discharged when they are ready to go home. I have no doubt from what I've read within patient experiences of being treated on Plemmoor Ward that rehabilitation patients are being discharged far too early and without the necessary care packages to support them in their homes. This situation is likely to continue and may become worse if we do not deal with this today and seek to find better alternatives. To quote the daughter of a patient, let's turn to physio. I was told by the hospital that my dad would receive ongoing physio by physios that work in the community. Dad's been discharged from hospital for 30 weeks and has had 10 visits, which were, to put it bluntly, useless. A physio arrives at the door, hands the living carer a sheet with a new exercise to follow, and off the physio goes. The physio does nothing but hand a sheet to the carer to figure out and do with the client. I've already had the experience of the carer doing an exercise incorrectly. Who knows what potential loss and damage could be done unintentionally. There is simply insufficient bed space on Plemmoor Ward, and that situation is only going to be exacerbated as years go by. Patients will continue to receive poor rehabilitation, may well have long-lasting effects, all because the Minister blindly follows the advice of its senior management, who have admitted the current rehabilitation provision does not meet expectations. Samaray Ward had far better bed capacity and facilities. So, sir, I ask members, let's treat islanders in a unit that can cope with their needs rather than persist with trying to make a silk purse out of a sow's ear. Plemmoor Ward is simply not coping with the numbers, and this will only get worse. P115 asks that Samaray Ward be opened by the 1st of March 2022. I believe that's achievable. It's clinically safe and is wanted by staff working in the rehabilitation unit on Plemmoor Ward. This will then provide those islanders who are unable to receive care at home the chance of receiving their care in first-rate facilities for part or all of 2022, and allow long-term plans to be made for similar or better rehabilitation facilities in Jersey. I understand and respect the state's decision to build a new hospital at Overdale, whether I personally agree with it or not, and P115 has not been brought forward as a mechanism to delay or block the progress of a new hospital. We've not yet agreed the Island Bridging Plan, and it will be some time before the planning inspector provides his thoughts on the recently submitted planning application for a new hospital. Never mind any firm date for any demolition at Overdale. That may well include Samaray Ward. So let's not miss the opportunity to support islanders in the short term who are suffering life-changing health issues and require the best opportunity for recovery by reinstating Samaray Ward. As I come to the end of the speech, I'll repeat the following analogy that was sent to me by a local doctor. Let us suppose Jersey is an aeroplane. At present, those requiring rehabilitation have all been relegated to economy class Plymouth ward. This is really cramped, noisy, there is little space, no privacy, and the cabin crew are always busy. Meanwhile, first class, Samurai ward, is available, not being used as it's deemed too expensive and not being used for its intended purpose. It could provide single rooms, specialist gym space, a large community dining area, easy access to outside space, room for therapies, and lots more. The question, sir, that members have to ask themselves is, would you like your loved ones to have the opportunity for 6-9 months a year in first class now, prospect of similar or better facilities in the future? Or are you content for them to remain in economy for the next 5 or 6 years? This is what you have to decide. I urge you to vote for first class. I urge you to give your loved ones, your parishioners, your constituents, the best possible chance of recovery. Why would you settle for less? And I urge you all for my proposition. I just want to add one final comment around the email that was sent this morning. I have again asked the Minister to provide further clarification about commitments to P115. I hope he's prepared to do that in his speech. I think what the public and supporters of P15, I think we are clear about what our intentions are within P115, and I do hope that the Minister, if he is going to accept P15, and the Council of Ministers are going to prepare to accept it, that they accept the ethos behind it and the content within it, and they can stick to the timeframes within it. But I urge members to vote for the proposition. Islanders deserve to have the best possible care, and for some that hasn't been achieved. So let's do our best to try to do that in the purpose-built facility at Samurai, at least in the short term, while we decide what we're going to do in the long term. Thank you, sir.
Very much. That's the proposition seconded.
Yes, sir. Yes, sir.
Does any member wish to speak on the proposition? Debate is now open. Senator Ferguson.
Thank you, sir. I would remind members of the Assembly that this is the Minister who did not think that there was any bullying in his department, contrary to what I and other states members actually know. So if members could bear that in mind, as Senator Pallett has said, it would have been nice if the health authorities could apologise for the way they have ignored the needs of rehabilitation patients, who tend usually to be the elderly and those least able to protest. It has been said that the authorities considered that Samaray's ward would be required for COVID patients. It seems to me that none of our recently appointed health officials have read the reports of the risk exercise conducted in, I think, 2017, which considered the risks implicit in a pandemic. One of the measures was to utilise the hotels for accommodation. This was a move recommended by such people as Colin Egray, the former deputy for St. Peter, who had a degree and practical experience in risk assessments. Why didn't the recent appointments actually read that report? This amendment by the Minister, which, okay, has just been withdrawn, but it's typical of the output from HCS, pure as, again, as Senator Pallett has said, it's pure jam tomorrow. 5,000 words with lots of glorious promises, but no practical and immediate solutions. As I recall, for example, there is only one disabled toilet on Plemont for the whole ward, and it's not exactly spacious. So how do you get into a non-spacious toilet with a Zimmer frame in tow? It just doesn't work. Those plans and words, we can all produce those. Those in this chamber, probably better than most. But our rehab patients need deeds. It is my understanding that the moves were undertaken without proper discussion with the consultants involved. Since when do civil servants really understand the implications of such a move? Given our highly paid operational consultant from the UK, even he overlooked the necessity of a unit which could be on the old TB, located on the old TB McKinstry ward. Even he overlooked the necessity for a unit to provide rehab and even step-down accommodation. And now Samaray's ward is providing offices for civil servants, apparently working on the Jersey Care model. Yet another jam tomorrow document. We need to stop issuing these wordy documents full of platitudes and pie in the sky and concentrate on the things that matter, which provide best patient care and reduce the strain on the hospital. In fact, it seems that we should gratefully, or is it gracefully, accept the resignations of the top layers of management and the minister and let people who know what they're doing replace them. Please vote for this proposition. Thank you, sir.
Thank you, Senator. Connie Tarver, St Mary.
Thank you, sir. I believe that we have all received emails in support of retaining the Samaray ward. These have come from professional people who work in this environment, including retired professionals and indeed the patients and relatives who have passed through, and those who are still receiving treatment. It is accepted that the existing Samaray ward cannot remain on site during the building program of a new hospital. So where is the planning brief for the new build of the hospital? The Samaray ward should have been the first concern. A new standalone facility would surely be built first on the agenda. Surely an ideal location would be the old Lake Innovate School. Whatever happens, an independent rehabilitation unit needs to be provided as a vital part of our health care. There should be a flawless decanting of the present Samaray ward to a purpose-provided facility. I and many people hope that this still can happen as soon as possible. Thank you, sir.
Connie Tarver, Deputy Gardner.
Thank you, sir. So, previous speakers shared with us and public many important details to support this proposition, including personal image, which we all received. So I'll not go again, compare between Plemont and the Samaray. I would like personally to address maybe a wider issue, which I hope not become a pattern, that we can break it now going forward. I personally, as others, I think, seen this debate taking place in our media and all over the internet. This debate has followed what seems to be the new normal format, which I hope it's not, but it feels. we have people, patients, our clients, who receive treatments, which is basically service, the relatives of the clients receiving the service, the workforce delivering the service to the clients, all saying the service has deteriorated. And our government saying it is equal or better. It happened several times during the Public Accounts Committee hearing over the last year. We have clients, relatives, our workforce listed personal experiences, dates, times, incidents, and systematic failures, and our government replying with data which at the best can be described as incomplete, inconsistent, and often partly or completely withheld because of data protection reasons, or claiming opposite. Sometimes it's really difficult to match responses and the data that we receive. Care for these patients is inadequate when they say it is. They are the clients, they're the end users, they're focus of our care. I really hope that in this instance, it seems they have been heard. It took a long time. Telling these patients, families, nurses, physiotherapists, and occupational therapists they are wrong is as peculiar as telling a person that they have warm enough clothes when they are standing in front of you, shivering and pointing to a broken thermometer as proof. We have to put this right before we go to catastrophic failure in a service which is already overstretched. I really hope we will adopt this proposition today, and hopefully our government has accepted that we need a dedicated rehabilitation unit. This is about care for brain injury patients, some of them at least least able of our population, some of them least able to speak up for themselves. And I'm thank you for Senator Pallet for bringing this proposition forward, because I think for a while we all was wondering how we are going to address it, because we felt that it's really wrong going there. So I do pleased that this patient had a persistent political voice in this assembly, and hope we will be able to overturn what I believe was a mistake. Saying that, I'm welcoming that the health minister withdraw his amendment, and I'm looking forward for his speech and seeing how the plans will move forward as well. Summary ward was the gold standard rehabilitation ward. I would like to hear reassurance from the minister that by accepting this proposition, we will see the same golden standard reinstated at Summary Ward and in the new location going forward that will be open soon. Thank you, sir.
Much, Deputy Colleague Harbison John.
Thank you, sir. And I rise to speak today for the first time in this assembly. Sir, I'm sure we all know someone who has been the victim of a stroke, and that strokes affect people of all ages. According to the Stroke Association, 1 in 3 people die. This is obviously devastating for the families left behind, but it can also be devastating for stroke survivors too. The Stroke Association say that many survivors find themselves grieving for the person they were before their stroke. I would like members to just think about that for a second. They often grieve for the person they once were. Rehabilitation is clearly not just limited to stroke survivors, but many of the clients are from this area. This assembly would be filled 3 times over every year with people needing rehabilitation services. In starting, sir, I'd like to place on record my thanks to all the frontline staff at the hospital, and especially those who are currently doing their very best on Plymouth Ward, something I witnessed firsthand last year, and I'll return to later. I should also acknowledge the work of the Health Minister, sir, during COVID, and I thank him for the 3 one-hour meetings I've had with him and some members of his leadership team, as I wanted to learn about our health services. Clearly, my inquiries didn't start and finish with the Health Minister. I've talked and listened to many, many health professionals from right across the department, clinicians, doctors, senior nursing staff, nurses, assistants and porters. They all have a story to tell, and I can tell you, sir, I have big concerns about our health service at present. Healthcare staff are desperate for help and want their views to be heard. Just 2 days before Christmas, the Minister and I had a 2-hour meeting with a constituent, again with members of his senior team, to discuss a particular stroke victim's case, and we've heard some of that from Senator Pallett. Let's be frank, despite having had repeated assurances from both the Health Minister and the Director General, both saying until very recently that there had been no deterioration in service over the last year and a half, the reality has been and is very different. You don't have to take my word for that. If you speak to health professionals working in the area, stroke charities, Headway, patients, and the families of patients, you'll get the same message. I plan to share with members what I've learnt. Most telling lesson of this, sir: people will continue to suffer lifelong disabilities that are avoidable. That means people are being discharged too early, and if they had longer in rehab, would regain more ability. This can't be allowed to continue. Having a rehabilitation facility on an acute ward just doesn't work. It doesn't work, sir, because as one health professional told me, it's a different ethos. Indeed, the Health Minister agreed with me. As an extract from Hansard on the 13th of December goes like this. I asked, would the Minister agree with me that it is a completely different ethos and that rehab on an open general ward is not conducive for rehab patients? The Deputy of St. Juan, yes. I accept that Plemel Ward is not Saumarez. Saumarez was spacious, it was calm, it was a different environment. The Minister repeated these qualities of Saumarez during question time yesterday. The important thing is that the statement, sir, is that it was spacious and it was calm. In fact, it is spacious, it is calm, and yet there's absolutely no recognition of either of those qualities in the amendment. Spacious and calm, a purpose-built facility just 5 minutes away. Sadly, sir, there's a fear culture amongst the people who work within health, and as Senator Pallett said, amongst patients. And I thank those who've spoken to me and others, and particularly those who spoke to the media. Only last night, sir, I was contacted by a health professional who told me Plemel is actually getting worse and worse. There are 21 patients there today. There should be 22, but one patient needs 2 bed spaces. That is the facts, not 14. I witnessed, sir, firsthand, along with dozens of others, the substandard facilities of Plemel when my late mother was a patient. This, whilst the purpose-built facility was not being utilised. Remember, sir, Plemel is not spacious and it is not calm. So at the last sitting, I made a couple of observations about the government plan following my short time in this assembly. I spoke about the need, in my opinion, for more collaboration between states members and the need for a more solutions-based approach. I've said a couple of times now, to me, it does not matter who brings a proposal. And again, I encourage members to take the same approach. Put your island and islanders first. I find myself repeating these words because we did have an amendment lodged at the very last moment, an amendment that had a lengthy report without actually saying anything of substance. As confirmed by Senator Pallett, he and I were both prepared to meet the Minister. We were given less than 24 hours for a time last Friday. I'm still waiting for the revised time, sir, and waiting to be called back. Collaboration, solutions-based, neither of those. Putting islanders first, we hope so. We were asked by the Minister to stick to his plan, 8 weeks. 8 weeks. I'll remind members, it's taken 87 weeks to start putting in a plan to reinstate a laundry facility for rehabilitation patients. It took many, many months to put in place a service contract for the gym equipment being used by rehab patients. Somebody complained that it was dangerous. There was no service contract. Improvements can be made and should be made and have been made. The day after the amendment was lodged, as we've heard, there were 6 beds in each bay and 3 bays, not 2, were being used. The ward is just not conducive for good rehabilitation. In the lengthy report, there is not one mention of rest. Sir, my limited knowledge and research, I realise that rest is vital for a rehabilitation patient. Sleep deprivation means patients can't get the most out of their physio. Samurai closed in March, not in May. Staff and families of patients have been let down during every one of those 87 weeks. They're being let down today, they'll be let down tomorrow. Finally heard a whispered apology from the Minister and the media. Some people have suggested the Minister was unaware. Well, I know for a fact, sir, that many people have spoken to him, including charities, and they've raised their concerns. I, sir, raised my concerns with the Minister in the corridor of Plemel back in July. July, sir. So I know that the Minister has known that things aren't good. I, sir, watch staff do their very best, what can only be described as very poor conditions. I watched patients, some with dementia, struggle in the environment. I watched as families struggled to cope, watching their loved ones on a daily, weekly basis. And if they were able to get dressed, they were able to move to a chair, that's where they'd spend their day, in the chair next to their bed. Physio and occupational therapy was hit and miss in terms of the frequency. The facilities the staff had to use being very, very basic, and staff would apologise to patients and their family for the facilities they had to operate in. A simple walk along a corridor was in itself difficult to achieve because of the lack of space. So I could go on at length about the experience of my family. It was just the same as other families at the time. It's the same for families from March 2020 to now. It has to change. We're told not to be emotional and listen to the clinicians. It's hard, sir. It's hard. Victims and their families not to get emotional. Imagine being struck down by an illness and not being able to do what you used to do. That could be an emotional for the family and the patient. Listen to the clinicians, we're told. Well, sir, I can confirm I have listened to the clinicians. They're experts in their field. Yesterday we heard that Samurai didn't keep records. That wasn't the facilities, but that was the process. Surely that's a quick win. I'm told that while Samurai wasn't perfect, it had its flaws, it has its flaws. It was brilliant compared to what we have now. We read in the report about the amount of complaints and compliments received. Where's the feedback data where patients scored the service they received? Where's the comparison to the feedback from Samurai? Didn't get that, did we? My family would have sent a card or a letter, sir, a compliment, but that in no way should be seen as any sort of endorsement of the services being offered. No, sir, that card or letter of thanks would have been to commend the team for doing their very, very best in what can only be described as very trying circumstances. It is my view, and the view of many, that the staff, sir, have been as let down as the patients. Some may see a reduction from 6 to 5 beds in the bay as a good thing, but what's the reality? When push comes to shove, the 6th bed will be back. People sharing a TV, noisy, disruptive patients. As one mother wrote to me, sir, Sharon Shepherd, and she asked me to quote her today, not only were there exceptional staff working together and a superb team at Samurai, it was the facilities. I cannot explain how important a single room and bathroom is to someone who's lost the ability to go to the bathroom by themselves. Be able to move into a wheelchair without others, strangers watching. She says, my son was a young lad and he was treated with dignity. All our islanders should be treated with dignity, sir. She goes on, how dare this government take this facility away from any of our islanders? My son did walk and run again. He lived his remaining time with us, loving life until his horrible disease took him at just 25 years. For all those other Harrys out there, she says, they deserve the absolute best we can possibly give them, not the shameful treatment they are now given. So let's compare that to now. We've heard about the hoists being too big, the toilets being too small. The medical director told us in a briefing on Thursday he had concerns about the proposition. He went on to tell us about the work required in lots of different aspects of rehabilitation. Well, I welcome that fact, sir. I welcome the fact we're now looking across the service to do things better and do things differently. The proposition does not stop any of that important work. We heard about data. It's not the fault of the buildings. He told us before we decide where, we need to decide what we do. I found that quite strange. Here we have someone arguing the case of a 14-bed facility when we have a 28-bed facility 5 minutes away, and we need to decide what we provide before we decide where. Seems to me we're being asked the exact opposite. We're being asked by the Minister to relocate Samurai on a permanent basis to Plemore, but we still haven't decided what we're going to do. For members who couldn't be part of the briefing, and even for those who did take part, I'll remind you of a couple of other things the medical director said. He acknowledged that things aren't ideal. Services on Plemore have not been to the standard he would have liked. He agreed the need for improvement and acknowledged, in his words, Samurai is an excellent facility. Well, I'd agree with that. He went on to say it wouldn't be helpful if, and I'll quote, politicians pushed us down a certain way. We also had an open letter from 2 senior members of staff this week explaining their concerns. Isn't it strange that these 2 employees can write open letters to politicians to influence policy, and when the staff who work in the area, the real experts, are frightened to pick up the phone or meet with their elected representatives? I remind members that it was this Assembly that approved the funding for Samurai in the first place. This Assembly that approved the funding for its refurbishment. We have not been asked about relocating rehabilitation, and it's for us to decide with respect to clinicians. It's us to decide how we use our resources. This is all about people, sir. This is not about buildings, about people who need treatment today, tomorrow, next week, next month, and next year. As I said, I've met many people. One lady I met had a stroke, and she wrote to me. Her father's had a stroke. She told me all about the challenges there are within the system. Lack of staffing. No criticism of the staff, sir, from anybody. They are doing their level best. She received a phone call 2 weeks before her father's discharge date to ask if he could go home that day. She said no. She'd had a stroke. She knew what questions to ask. Not everybody is experienced. Sir, people struggle. It's a shock to people. Her 81-year-old mum was found with 5 people in front of her trying to convince her to take her father home. When she got involved, the final review meeting did not happen, and she was informed it was too expensive to get all the professionals together. This lady's father was home for 6 weeks, 6 weeks before he was visited by physio and speech and language. And they are not sure to this day if he's been signed off following speech and language and occupational therapy visit. In her experience, when she had a stroke, noise, movement, bright lights and busy surrounding is not what a person wants. They want calm, peace. They don't want noise. They are trying to come to terms with a massive life-changing event. She goes on to say that a month ago, our only choice could have been a nursing home for our father. It infuriates me. He was seen as medically fit, so there was no more the hospital could do. I also can't help but think of the families and stroke survivors that don't have the knowledge I do. I knew the questions that needed to be asked, she says. what needed to be done. Most families find themselves in the middle of a nightmare. The difference in both my experiences was like night and day. I consider myself lucky. Another family member wrote about their family's ordeal, and she finished by saying, the bottom line is rehabilitation needs to be in a setting where the patient has all the amenities they need to hand. So the Director General of HCS in the hearing in this room with PAC on the 29th of November insisted that there had been no reduction in services, but rather a different way of delivering those services. When I challenged this assertion, sir, the Director General rejected the view, saying the resources on Samray and Plemel were exactly the same. Well, sir, one facility had 28 beds, the current has 14. The resource was the same, the treatment would have improved, not deteriorated. The Director General admitted, however, resources might not be used as effectively as they could be. The staff can't work any harder, sir. The staff work incredibly hard in difficult conditions. On Samray, patients received physiotherapy regularly, but on Plemel, they're going days without receiving either. I know that from personal experience, sir. One person contacted me saying, my partner's been in hospital for 10 weeks and the physio in rehab has been basically non-existent. At the PAC hearing, the Director General also said, HCS put their hand up if they get things wrong. Today, sir, is the day for them to put their hands up and for us to move forward. I'd also encourage them to put their hands up and ask for help. When I met with the Health Minister in August with his General Manager, I was shocked that Health and Social Services, HCS, had an 8% vacancy level. Based on their figures of 2,500 people, that would be 200 staff. I wrote to the Minister on the 28th of October because a spokesman had claimed the vacancy level was 5.4%. That's 130 vacancies. In fact, that vacancy rate was reaffirmed a few days later in this House and is in Hansard. And it says, in answer to a question from Deputy Southern, there is no recruitment crisis in HCS. The organisation has a vacancy rate of 5.3% currently. That is not unusual for an organisation of this size. Well, sir, a Freedom of Information officer received last week, asked on the 1st of November, so a day before that statement, we now have 353 vacancies or 14.12% vacancies. I ask you, sir, two public documents, which one is right? I would suggest, given the pressure I've witnessed and other people have witnessed the staff being under, that the higher number is true. I would acknowledge, sir, the great work that's going on within training within HCS. I look forward, sir. On October 1st, 2021, the clinical director for our hospital, when answering questions on BBC Radio, said, we have got 5 years to sort this out. I'm here to tell members we don't have 5 years, 5 months or 5 weeks. So people suffer illnesses all the time. We have a duty to provide the best we can, the best in terms of facilities and the best in terms of care. Talking to staff, I'm told the reason there is no rehab facility planned for the new hospital is because it wasn't in the brief. More than one professional has told me that the clinical director for our new hospital was insistent that it wasn't in the brief, it wasn't going to happen. As one doctor wrote to me, a rehab centre is vital.
I afforded you your request an extra 5 minutes. We're now over 20 minutes. I'm afraid I have to ask you to stop. There's a guillotine, 15-minute limit, I'm afraid.
Thanks,
and you've already spoken for 20 in accordance with a prior arrangement that you asked for that latitude. Deputy of St. Juan. Deputy of St. Juan.
Thank you, sir. Sir, right at the outset, I want to acknowledge that for some patients in Plemel Ward, Health and Community Services has not delivered its services to the standards it aspires to. I'll explain why that might have occurred shortly, but I and my team wish to apologise for those shortcomings. We recognise that some patients' experiences of care were not good and significantly impacted on their recovery. In HCS, we seek to learn from every patient story we receive and use that learning to continually improve the care that we deliver. Now, I'm afraid we won't always get it right, because we are all human, and despite best endeavours, we will get things wrong in the future. But we will continue to strive to be a learning organisation where our staff continuously learn and enhance their capabilities. We want to generate knowledge and apply that knowledge to improving practice and continue to listen actively to our patients. With Samurai, we have listened, but we haven't actively listened. And to those patients who feel their voice has not been heard, I do apologise. However, I know that no member of our staff comes to work intending to deliver poor quality care or patient experiences. And I want to praise and thank the team in Plemmoor Ward for delivering good care to the 335 patients who have passed through Plemmoor Ward since the rehabilitation services moved there. They've not been able to control the environment, but despite that, they have still continued to give of themselves every day for our patients, and for that, I thank them. So I'd like to take members back to March 2020, when the public health modelling was suggesting that the island was facing up to 500 deaths and many hundreds more in hospital. There was a real fear that hospital services would be overwhelmed. The decision was taken to close Samurai Ward and move staff engaged in rehabilitation services to the General Hospital. Most hospital staff, therefore, would be located on one site to be deployed in ways best judged to meet the threat of the pandemic. The Samurai Ward was proposed as a step-down facility from Nightingale for the patients who no longer needed oxygen. All of this was the right thing to do, and the decision was taken in consultation with the consultants involved. At that time, the onset of the pandemic, there was huge anxiety felt by frontline workers in all services. There was fear for their families, their patients, their colleagues, and themselves. The pandemic was a complete unknown, but they willingly stepped up and they placed themselves in the vanguard of our response. But with a major incident, you eventually moved to a recovery and restored to normal position and business as usual. But for the last 2 years, HCS has, through necessity, been in escalation as they've responded to the repeated waves, currently being in response wave 4. It's unprecedented for any community to face a major incident continuously for almost 2 years with no respite. When there has been a lull in the COVID pressures, we needed our staff to try and grab some rest and try to recuperate. And on returning, they led our increased efforts to meet the backlog in waiting lists caused by COVID. And lo and behold, another wave appears on the horizon. In these last 2 years, the way healthcare is delivered has been turned on its head. It has been a burning platform on which we've taken many scolds, but because of the resilience and fortitude of our staff, we've also innovated and improvised and transformed some of the ways we deliver care for patients. Our staff have had to get used to a hospital which operates 2 streams and keeps those streams entirely separate as hot and cold. Staff were often deployed to serve in areas they're unfamiliar with, but they have met those challenges uncomplainingly and strive to deliver great care. For almost 2 years, they've spent long shifts in full PPE with their masks sealed tightly on their faces, which makes communication so difficult between themselves, their patients and their families, but it's the necessary thing to do to keep our patients safe. Our staff, and perhaps particularly those with family outside of the island, could feel disconnected from their usual support networks. And for some of them, they were not able to say any goodbye to a loved one or attend a funeral. Colleagues who were sitting at the bedside of patients as they lay dying because families could not enter hospital. Their hands were gloved and their faces were masked, but they offered all the solace they could in those terrible circumstances. That awful experience and all the other harms caused by COVID in healthcare is felt so deeply by the whole body of staff, and it remains in their psyche whether they're personally involved or not, because it's a million miles from how they and the whole of HCS would want to deliver compassionate care. And I salute them. For us who don't work on the front line in healthcare, we behave as if we've got the hang of this COVID thing by now. Most times we live with it. Sure, there are little inconveniences like testing ourselves and putting on masks, but it's great that we can get back to restaurants, we can pursue our sports and interests, but that's not the case in healthcare. We know schools and school staff have also had significant challenges. And quite rightly, many members have drawn attention to the difficult circumstances faced by school staff. They may know something of the anxiety felt by healthcare workers having to come to work daily and try to deliver the best care within suboptimal conditions while putting themselves at risk of infection. But how much more has been the effect on healthcare workers who have seen patients suffer grievously and sometimes die? Do no harm. Do no harm is the oath of our healthcare staff, and they live that oath every day. So please, we can imagine their pain when, despite their best efforts, patients die because of this merciless virus. So all of this over 2 years has resulted in a significant impact on our staff and services. If you ask me whether any part of HCS services is unaffected by COVID, my answer is no. It has not been possible in so many cases to deliver healthcare in the way staff are trained to do and wish to do. Clemmer Ward has not been different. The staff there have suffered the same anxieties and they feel the same concerns for their patients, their families, and themselves. In addition, they've had to adapt to a time of rapid change of where they work, adapt the care for most of their patients in bays rather than single rooms. And for a long time, they didn't know whether they might have to move again. All of this was beyond their control, and still they worked to deliver the best care they could for their patients. So I am so proud and grateful to all the HCS staff who've had to work through exceptional times, the exceptional times we've experienced. Delivering healthcare is challenging, but never in the way it has been over the last 2 years. On many occasions, staff have been asked to step up above and beyond what is normally expected of them. They've made many sacrifices and suffered physical and mental exhaustion, yet they've shown dedication and determination. And so when I speak of staff, I include managers, which to some people I note seems to be a dirty word. But so many of our managers are clinicians themselves and work on the front line. They have carried the responsibility for providing hospital services to COVID-infected patients and finding ways to still deliver all the usual care services throughout a pandemic which has caused such disruption. Let's not be overly surprised that things haven't always gone to plan over the last 2 years. I and my team acknowledge that we took the eye off the ball in relation to Samurai Ward and the care provided there. And I must thank States members and members of our island community for raising my eyes from the horizon of the pandemic and highlighting to me that we were not delivering the care that we aspire to deliver for all of our rehabilitation patients. I've now heard, and I and my team, we've sometimes been distracted by the ceaseless demands of the pandemic, and we may have missed raised flags that in different times we would have seen. But I apologize again to our patients and to our staff. What staff all had to endure has affected delivery of services and for managers, their capacity to work closely with the whole range of services when they've had to focus on keeping care services open and operating safely in the pandemic. Hugely regrettably, that's meant the outcomes for some patients have not been as good as they might have been in more normal times. I wish it could have been different. We all wish this pandemic had not happened. So when this assembly asked me to be health minister, it soon became clear to me that HCS faced many challenges, because historically in the department, there had been no recognizable governance framework or quality and safety framework. And therefore, it's been difficult to ensure and demonstrate that the care delivered was patient-focused and safe. And that includes in our rehabilitation services and our former Samurai Ward. We subscribe to something called the Sentinel Stroke National Audit Programme, sometimes called SNAP. The last data is from 2019, and it demonstrates that we were not delivering optimum care for our stroke patients on Samurai Ward. And we're seeking to learn from that national audit and deliver rehabilitation care that is more responsive to our patients' needs, pathways that are owned by our patients and care plans that are agreed with them. We want to deliver the great rehabilitation care for our patients that our clinicians say is possible. We want our patients to recover and return to their homes and loved ones as close to their baseline presentation as possible. And the work we're doing, which is being led by our chief nurse and our director of improvement, is completely focused on that outcome. We'll be asking former patients to join us on that improvement journey so that we hear the voices of the people who use our services. Samurai Ward was a building. Care happens regardless of buildings. Care is about the people delivering, the people receiving. It's that Samurai ethos that we are striving to rebuild. And step by step, HCS as a whole department is being transformed through changes in the organization as it strives to achieve a culture based on quality and safety. Healthcare must be delivered within a culture that embraces safety as the predominant driver. Otherwise, there's a high chance of failing to put the patient first in everything we do. And there's been so many challenges in HCS, but predominantly it's been the lack of standard processes. But that's beginning to change. We are now measuring and monitoring private and public activity. We are creating quality standards based on the safety of our patients. We are collecting good data and beginning to measure performance. We at last have accurate waiting list data, and we are proactively managing waiting lists to ensure that our patients receive the correct priority. And throughout HCS, we've introduced a governance framework from the minister sitting at the top of a board which meets in public, to care groups which meet as an entirely clinical body to discuss outcomes for their patients on a very regular basis. For the last 3 years, 2 of which have been in the pandemic, we've been working to introduce those processes and procedures that are standard in other healthcare economies, that look outwards instead of inwards, that challenge poor behavior and establish frameworks in line with recognized best practice by which we can deliver care that is safe, qualitative, and measurable. We're working to introduce change that will put the patient at the center of all that we do. But I have to tell members will know change is not easy within a culture that has not previously had meaningful management and governance structures in situ. And I and my team recognize that some staff are struggling with the quality improvement program that we're pursuing, and some staff will be fearful of it. And so we're investing significantly in staff well-being and organizational development to support those members of staff, to help them achieve the change that we need in order to deliver a culture which is based on quality and safety. So, sir, we will not just have the patient stories, valuable though they are, and we want them. They're sometimes emotive. They're sometimes very difficult to hear. We will use them, but not solely to drive improvement. We will also have, because of the processes we're putting in place, meaningful evidence of outcomes and the assurance that services are safe and of high quality. Sir, at present, the health service is facing an avalanche of criticism and condemnation on social media, traditional media, requests, freedom of information requests, and individuals from within our community. And some of that is misinformed, is personalized, and it does not help with the work HCS is trying to do. Indeed, I would go as far as to say it can be unsafe. We always welcome feedback on our services, but I would just put out a plea that it is respectful of our staff and recognises that everyone in HCS is coming to work to do their best every day. We're a health service striving to deliver healthcare for our community within a pandemic, and we are the only hospital in this jurisdiction. I put out that plea for some support, some understanding of the work we're trying to do, some compassion for our duty of care which we seek to discharge every day. I recognise we're not always getting it right, as I have stated, but that understanding would mean and would begin to transform and help the journey along. And we want to hear from those patients who are not getting good experiences. We want to use that experience to learn. We want to have that understanding and dialogue with them. If state members hear of those experiences, please let me know. I don't think it's productive that state members tell me that they've got loads of complaints, but they're not going to share it with me. I ask state members, how is that in the interests of our patients? How does it help me to get things right for the patient you're speaking to? Because misunderstandings arise, and they have arisen, and they're perpetuated with the result that false impressions develop and gain traction. So there is misunderstandings, misinformation out there. I could give so many examples, but I'll try and correct just a few. For example, it is said that meals were cooked for patients in the kitchen at Samurai. That never happened. There's been criticism about commodes being used in Clemore Ward. Sir, Samurai Ward had commodes. The rooms in Samurai Ward were not ensuite rooms. Commodes are standard equipment in hospitals. Sir, it's been said that the bathroom in Clemore cannot be accessed with a hoist. It can. So there's been a suggestion that there's a need to carry patients on a hoist from their bed to the toilet. No, sir. A hoist is used to hoist from the bed to a commode, which is placed behind the curtain around the bed, or hoist to a chair beside the bed, which is then wheeled to a place over a toilet. That's standard procedure in hospitals. We do not hoist somebody and leave them swinging on a hoist as we move them to a bathroom. So it is said that the ward manager on Clemore Ward is not engaging. That's not right. The ward manager is there every day, supporting our staff and speaking to our patients. So it's been said the lead nurse for the improvement programme has never even been on Clemore Ward. That is wrong. She is there every day, supporting our staff, speaking to our patients. Members of this assembly received an email, and it was said of that individual, she had been groomed by management. I feel for her that that is derogatory, hurtful, and surely against the values we seek to uphold. Sir, it is said there's no support by mental health services and other therapies. I confirm there is such support. And antidepressants are not unnecessarily thrown into medication. There are strict regulatory requirements on doctors around the prescribing of medication. To make such a statement gives the clear implication that clinicians are guilty of malpractice. That's such a serious allegation to make of a professional person employed by the government of Jersey. And there's a need to provide evidence if that's going to be said, rather than put out throwaway remarks. So there are so many other statements which I regret to say are incorrect, even inflammatory, sometimes misleading. And I've seen in some cases that misunderstanding arising because of difficulties in communication. And yes, communication is key, and communication has become so much more difficult over the last 2 years because of all the additional measures in the hospital that effectively are trying to prevent people getting close to each other, and especially around PPE, when staff have to talk to patients and to families with those close-fitting masks. So we must understand that communication is so important, but there are those struggles over it. So we're planning improvements in our rehabilitation services to put the patients at the centre of all that we do. Sir, excuse me. Senator Pallett's proposition requests me to reinstate the services. And whilst they've never stopped, I can commit to developing the rehabilitation services that we had even further, that we will advance good care in all healthcare settings. We're going to advance rather than look backwards. And we recognise that medical practice is constantly changing. So there will be no one model that was determined years ago that we will fix on for years and years to come. We will develop services continually in line with the best advice. So that improvement plan is there, is being pursued, and was presented to States members last week, and I believe received a good reception. I'm going to invite Senator Pallett to meet our team and attend a meeting of the group that oversees the Rehabilitation Improvement Plan, which is led by the Chief Nurse and the Director of Improvement. Senator Pallett's proposition asks me to deliver either at Samurai Ward or at another suitable location as determined by me. And I will make that determination. I commit to continuing to look at all options. And I acknowledge absolutely the intensity of people's feelings towards the former Samurai Ward. I will look at all options. I will be acting, well, I will be taking the advice of the medical director, the chief nurse, who are the accountable officers and the persons in our organisation responsible for patient safety and the quality of care. I want to ensure that we deliver the best care possible and safe care to our patients. I'll also be taking advice from an external expert who's also assisting HCS at present around our quality and safety framework. His name is Professor Hugo Massey-Taylor, and I will ensure that Senator Pallett also has all the time he needs to speak to Professor Massey-Taylor also. So by 2026, it is imperative that we will be moving to our new hospital. That is an outcome that above all, we must achieve. In the new hospital, there will be access to rehabilitation on every ward. It will be in the lifeblood that flows through the whole hospital. There will be a dedicated medical ward with up to 30 beds as needed, most of them in single or suite rooms. We will be in a position to deliver the best rehabilitation that can be given in a new and a modern hospital. Therefore, sir, I'm in a position after careful reflection to support Senator Pallett's proposition. We will see in rapid time the implementation of the changes we've committed to in our improvement plan. And I commit to making that determination requested, and I commit to reporting back to States members by no later than the 1st of March. And I thank members for hearing me out.
Thank you very much, Minister. Would you give way for, there are 2 points of clarification, the first from Senator Ferguson and the second from Deputy Morell. Do you give way for points of clarification?
Yes, I will, sir.
Senator Ferguson.
Thank you, sir. Well, how many times has the Minister taken a walk round the hospital in the last year?
Is that a point of clarification? I'm afraid I stepped out for a few minutes and I don't know if the Minister made any statements. Very well, yes, that's a valid point of clarification.
I'm not sure I spoke about the times I've walked around the hospital, but they are innumerable. I can't come up with a number in my head, but I've often been in the hospital.
Well, and Deputy Morell.
How come nobody spotted you?
I'm sorry, there's no room for an exchange. You've asked for a point of clarification, Senator. The Minister has given his point of clarification, and that's an end to that particular point. Deputy Morell.
Thank you, sir. Just something there. Okay. In his speech, the Minister said that he said the medical director and the chief nurse are the accountable officers. Could he clarify whether this is correct, please? Because I understood it as the Director General who is the accountable officer.
Yes, I'm sorry. Perhaps the correct phraseology is the responsible officers.
Very well. Conataba St Martin. Oh, I beg your pardon. If you could pause, Conataba. You just put an entry in saying clarification, Deputy Young. Are you seeking a point of clarification from the Minister?
Yes, please, if I may. Sorry, I may have
Yes.
late on the button. But sir, if I could ask the Minister spoke about governance changes, which I think are very important in the way we take health services forward. Could he just tell us, clarify whether that governance is sufficiently independent and whether it's, or just is it an internal part of government machinery? I think that's an important principle. The governance where the patients groups, the user groups, etc., have a channel for their opinion, sir. Thank you.
So at the moment, the governance is internal, so it is myself at the head of it. Assistant ministers sit on the committees at the next tier, and thereafter it is our staff leaders. But it's a journey we're on, and I'm aware of possibilities that have been discussed, and this is mooted in the Controller and Auditor General reports of an external chair that might be appropriate to be involved with governance. So it's not inflexible. I should say that we sit as a HCS board with our partners, and that includes GPs and all the charitable providers, not all, representatives of the charitable providers, and patient voice. Certainly in our proposals on developing the Jersey Care model, we want to ensure and create a body that will give patient voice, and throughout the system we want to draw in the patient voice more and more, and that's part of the rehabilitation improvement plan also. Thank you, sir.
Very much, Minister Verreau. Conataba St Martin.
Thank you, sir. I am pleased and truly grateful to Senator Pallett that he's brought this proposition to reinstate the stroke unit summary ward to the Assembly for debate. Two of my close relatives, an aunt and a cousin, my cousin is exactly the same age as me, received excellent rehabilitative care in Summary Ward, and I visited the unit often. But I speak today not only to support Senator Pallett's proposition, but also to seek reassurance that if the stroke unit is relocated back to Summary Ward, that the assisted reproduction unit is safe. The ARU unit, infertility unit, was moved from their dedicated unit in the hospital, which was ideally situated and well equipped, and against their wishes, they were moved to Summary Ward. And I know that the ARU felt dreadful about being relocated to a well-equipped and dedicated stroke facility, and felt that stroke patients should have remained there. I seek assurance from the Minister that the vital assisted reproduction unit will not be affected by this move, and any disruption to the AR units will be minimal. I wish to make it clear that I do not wish in any way to delay or block the reinstatement of Summary Ward. Rather, what I seek to do is to ensure that our vitally needed assisted reproduction unit is not deemed as collateral damage for the reinstatement of the much needed Summary Ward. I'm supporting Senator Pallett in his proposition. We need this proposition to go through, and I ask for assurance that the assisted reproduction unit is not a fatality of this move. I expect this proposition to pass. We do not need any more evidence than has been said today to see just how badly the stroke unit at Summary Ward is needed. The island deserves an excellent dedicated stroke unit. As ever, I will be watching closely to see that the Summary Ward is reinstated and that the assisted reproduction unit is rehomed in an appropriate unit. I urge all members to support this proposition. Thank you, sir.
Deputy Morell.
Thank you, sir. I must admit, I know a couple of States members have congratulated the Health Minister on his speech. They felt it was brilliant. They felt it was worthy of approbation. But unfortunately, sir, I was disappointed by the Health Minister's speech. And the reason for that is because whilst acknowledging faults and accepting that communications had been poor. He didn't seem to actually get to grips with the meat and bones of this proposition and what this proposition is about. It rested on emotion rather than fact. And the fact is, and this is so sad to say this, but when the health minister acknowledged that, in his words, we took the eye off the ball with regard to Samurai Ward, he opened up a bigger issue, which is why then, on the 6th of December, in I believe it was scrutiny, or no, it's in a response to the petition of the reopening of Samurai Ward, did that response not acknowledge any of this? Why did it take this proposition to bring out all these complaints about the quality of service, about the quality of care, and so on that's been delivered through Plemont Ward? Why did it take this proposition for the health minister and his leadership team to listen? Because they said on the 6th of December in response to that proposition, or maybe it's 10th of December, sorry, in response to that proposition, HES will continue to listen to patients' views and consult with local charities. There is no reduction in the package of care being delivered. HES will continue to monitor outcomes following the changes in the location of the rehabilitation service. This can be captured in the range of metrics. It's clear to me that despite those words, nothing changed. And we know this because those comments were made on the 6th of December. Senator Pallett lodged his proposition on the 10th of December. On the 11th of January, the minister lodged an amendment to Senator Pallett's proposition, which effectively, through the nature of the amendment, told us we're not listening. And in the intervening period, in the 6 weeks since Senator Pallett lodged his proposition, I and so many other states members have heard story after story from both people who work within the health service and patients themselves, alerting us to many, many problems. And we know COVID has had a huge impact. We absolutely understand that. But something, in this case, Samurai Ward, when the closure happened, people were concerned straight away that it would not reopen. Those were some of the first things that I was told. The comments were made to me by islanders. And sure enough, months later, we find out it's not going to reopen. That's surreptitious in its nature. It's strange. It doesn't engender trust. Yesterday, I asked questions about the integrity of the planning system. This is about the integrity of islanders' views of the integrity of the leaders of the health service. And it just doesn't stack up. And so the minister's speech today, full of contrition, full of, we'll listen, we'll learn, but we have heard those words before. They are in black and white. They are there on the 6th of December telling us that we are listening and everything's fine. It doesn't add up. And that's why I feel such disappointment, because we know that the minister has acted incredibly fast throughout this COVID period. I can only imagine how tiring that must have been for him and all the people in the leadership of the health service and all the people delivering services directly. But none of that is an excuse for closing your ears to people who use your services. It's never an excuse for doing that. But the difference in communication from the 6th of December till today is so vast, is so massive a gap, that it is clear that those ears have been closed and that listening has been a token effort, not a real, genuine effort. And that makes me so incredibly sad. And it then goes on further. As that response to the petition said, this can be captured in a range of metrics. I'm afraid, Minister, those metrics are not capturing the right things. It's clear, because the minister believed that everything was effectively fine. Islanders experiencing the service were screaming at us, it is not fine. The service is much, much worse. It is not correct up in Plemont. And so I think the minister needs to understand that metrics are not everything. Metrics cannot capture everything, and that they really need to go back and find a better way of listening to people who experience their services. It's quite simple. The reality of the service delivered and experienced by islanders does not match what we as states members and other islands are being told by Health and Community Services. The other problem when I listened to the Minister's speech was that, again, full of contrition and emotional appeals. But what we had been faced with as states members who aren't in the health area, and I appreciate health is so complex, but what we had to put up with were thinly veiled, in my opinion, Soviet-style propaganda videos, which again ignored islanders' actual experiences. We had a video about the wonderful services on Plemon Ward, which didn't include any patients on Plemon Ward. It didn't include anyone, even for, I understand the need for anonymity, but I'm sure someone could have been found to have their head obscured in some way so that we couldn't identify them. But it was entirely acted by non-patients. And that does not engender trust. And at the heart of a health service, there has to be a sense of trust between those being treated, those treating them, and the administration and the ministerial responsibility that allows all those services to be delivered. And I'm really concerned that that is falling apart at the moment. I've talked to staff who feel bullied, who feel overstretched, who feel that they are not being listened to. I've spoken to patients who feel that they are not being listened to, who are concerned about the length of time it takes for diagnoses, the length of time it takes to be on waiting lists. Indeed, we heard, I know this is a slight aside, so we heard in questions yesterday about one service where it's 40 weeks waiting list if you're on the public system, and it's a matter of a few weeks if you're in the private system. This isn't engendering trust among islanders in our health service. And this is all at a time when we're trying to deliver an enormously expensive hospital and change the health service to a new care model, whilst improving the maternity unit, whilst improving, in fact, having to entirely restructure mental health services, whilst also dealing with a pandemic. It does feel, sir, as though not just the minister, but all of us perhaps have put too much on the health system right now. Because how do you cope with a restructure, a new hospital, rebuilding services which aren't working, as well as a pandemic? And so, sir, I accept when the minister says, you know, there is so much going on, it is so difficult. I appreciate that, and perhaps we have put too much on the health service, and I think perhaps ministers do need to think about that. Because at the moment, it does feel like the health service is not working for islanders in many, many areas. What I will say, sir, is it is right. It is better to get to the right decision late rather than not at all. And it is right that the minister has withdrawn his amendment. Senator Pallett's proposition has served a purpose greater than simply the reopening of SAMRE. It has acted as a catalyst for islanders to gain the courage to speak out, whether they work in the system or whether they are patients themselves. What I would say, sir, is that I feel the minister needs to find a way of gaining his own insight into people's experiences. I don't believe the minister can rely on those metrics. He cannot rely on accountants. He cannot rely on number crunching and statistics as his sole means of understanding whether things are working properly or not, sir. And so when it comes to not just SAMRE Ward, but the changing of other services and the way other services are delivered, there has to be a lot of learning from this, because this has been entirely the wrong way to go about things. A surreptitious closing of a ward, a non-reopening of the ward, denials about lack of quality of service and lack of quality of care, and then a sudden acceptance that there is a lack of quality of service and lack of quality of care. That's not the way to go about it, sir. So please, Minister, please do learn from this in so many ways. Islanders are really struggling to understand that the health service is being run in the right way. They're really struggling to understand that, and I say that with a massively heavy heart, because I know Deputy St. Juan, I have backed him time and again. He was the state's choice for minister, the Assembly's choice for minister, and I want him to succeed. But I'm afraid that does mean for these last few months of this Assembly, changing the way as minister he listens to islanders and their concerns about the health service, because those concerns run very deep, sir. And this is just one example of where people are deeply concerned. Thank you.
Very much, Deputy Ward.
Thank you, sir. And it's as one listens to a debate like this, one makes a lot of notes. So there's a lot to be said. So I think there were 5 areas that one could focus in. One is the context of this proposition and the amendment that was lodged and the wording, which I want to talk about, and that is the second, the implication and the concerns I have over what the minister has said. There's evidence that we have all received, and we've all received so many emails and so many pieces of correspondence about this, and so many have been quoted, but I think 1 or 2 little points that I would like to add to those. There's the reality of the experience of people and their rehabilitation, which, as the previous speaker said, I think he meant this, it's more than just a metric that can be measured on a spreadsheet, and that's so important. And then there's that issue of the culture in the health services, and indeed other states areas. And so in a previous sort of a role, I did casework to support people in states employment, and I obviously naively hoped that the days of people being fearful of speaking out may be going, but they seem to still be here. And if I say one thing to the health minister, please address that issue, because it's not professional and it does not support staff if they feel they cannot speak out. And a mechanism has to be in place for complaints in the state's system, in the public services, if we are going to recruit, retain and respect our staff, genuinely respect them, rather than just give well-earned accolades, but they need to be backed up with something. So the context of this proposition, I have a concern, and I will say I have a great deal of the Constable of St John has grown in my respect over his short time in the Assembly, because one particular reason is that he does take an approach of actually listening to the debate and coming up with detail, and I think we should all be learning from that. And I would say to Senator Pallett that that's certainly what I've done with your proposition. And let's forget what may happen in elections. This is too important. But I would say to the Senator, my concern is the wording again, and I support this, but the Minister had an amendment that was so diametrically opposed to this proposition happening, and then we were briefed, and I went to that briefing, as I do to all of the briefings, and yet again we experienced the full force of government ability to bring people to really oppose propositions from states members. And I came away thinking this debate was going to be really difficult today because of that. And then literally at the 11th hour, somebody mentioned that amendment was removed. And so I'm afraid I have a huge suspicion around that, because the wording says no later than the 1st of March 2022. So I fell foul of this myself, because now I'm reading that as on the end of, the end of February, a minute to midnight, that something will be done, because that seems to be the approach of the government. And I really hope that the Senator can take that on board and really push, because you're going to have to keep pushing to get this to happen. And then either at Summeray Ward or at Overdale, or another suitable location as determined by the Minister. And we've said there will be, and the Minister himself has said that there will be another consultant coming over to look at this, and he's taking advice. Also, we've been told quite powerfully at the presentation that we had that the advice is very simple, to keep things the way they are, and that's suddenly changed. So I'm really concerned that that first bit of the proposition will actually be enacted, and Summeray Ward will actually be reinstated. And I want to raise that in the Assembly for future reference. Now, a purpose-built rehabilitation unit offering a full suite of stroke and injury rehabilitation services as the new hospital campus. I can see no reason why that can't happen. It should absolutely happen. So I have less concern over the second part of the proposition. So that's my concerns over the context of the proposition, the amendment, and the implications of whether or not this will actually happen. Now, in terms of the evidence, we've heard so much, but there's a couple of bits I hope other people haven't used, because we've all received a lot of evidence. And I will try and take in many emotional words out of this as I can. A doctor wrote, a rehab centre is vital in the current situation. We should have been expanding specialist rehab rather than diminishing it. The space and facilities are insufficient when you try to run a rehab unit on a medical ward. It will never be the same as a dedicated unit. And that is so important. And then there's a really key point that on Samurai, patients could socialise together, get up and about when able, eat meals together and quickly establish a more normal routine. That normality of routine when you've been ill is vital. On Plemont, there aren't the facilities for them to do that, so they are basically hospitalised rather than rehabilitated. And so I think that is the key to this debate. We do not want to be hospitalising people, we want to rehabilitate, and the facility of rehabilitation strikes me as a very subtle but an important difference. So the other thing is that in terms of the importance of strokes units, as demographics change and illness changes, that actually the need for stroke rehabilitation may grow rather than it shrink. And we have been told, given evidence, that one senior doctor wrote that they were told by a member of the senior executive that Jersey had far fewer strokes now, and that Samurai Ward was no longer required. Now, so if that is one of the underlying drivers behind this, I think we really need to think carefully about this. And I go back to my initial point about the implementation. If the underlying foundations of an argument remain and aren't going to be addressed, then the outcomes will be the same, regardless of what happens with this proposition. And I am concerned about that. So when people have a stroke, the recovery period can be an extremely long time, and we cannot be discharging people into care that doesn't exist or is very difficult to provide just because it is the convenient way, and that's probably the wrong word, so I apologize if people see that as the wrong word, for the facility that we have. We need to put people first in all of this, and that access to rehabilitation is vital if you're going to avoid lifelong disabilities that could have been prevented because of early intervention and purposeful intervention when somebody is ill. And so I think that is the reality of experience that I mentioned earlier. The reality of experience for people going through major life-changing situations is that they need time and they need support. And if we measure the success of our society and how we support the most vulnerable in our society, that would be a much better measure than if we measure how many expensive yachts are in the harbour. That's one of the things I think we need to remember when we talk about this type of thing. So finally, in terms of the culture in health service, I want to go back to that and say to the Minister, please, there should be no situation whereby workers cannot speak up about their concerns, particularly in health and particularly in any of the areas that deal with vulnerable people or children. That must be there, and it's not simply a whistleblowing hotline. It is about management that is sensitive and open to criticism in its truest sense, and so that does not seem to be existing at the moment. I'm not going to go over the video that we saw because people have already, I think, successfully taken that apart. It was inappropriate, it was unnecessary, and as States members, so that's not the type of thing that we want for this debate. So I hope that we will vote for this proposition today, but I also hope that it will actually be implemented. And I say to the Senator, sir, that please ensure and be careful that what we agree today actually happens, because unfortunately, I think we have a culture in government where things are delayed or manipulated in a way so that what you think is going to happen isn't. So I urge members to support this proposition, and let's repair the damage that has been done, move forward, and then look very sensibly about the type of rehabilitation services we can have with the opportunity of a new hospital. Thank you, sir.
Good afternoon. Does any other member wish to speak on the Deputy of St Martin?
Well, thank you, sir. Sir, the first thing one needs to do when you try to fix a problem is to accept that there is a problem. And I'd like to think that the Minister has, at long last, realised that there are issues in health. But I have to say also, sir, that I'm not 100% convinced, and I'm concerned. The wording of the Minister's email sent to all States members late last night concerns me. And I quote from it when he says, after long discussion and having carefully considered against the wording of the main proposition, we now believe that we can accept the request as it has worded. And I'm concerned, sir, because I was hoping the Minister was going to tell us in his response what there is in the wording that has somehow changed from when the proposition was first lodged and he lodged his amendment. I'm also concerned, sir, because during his speech, the Minister said he was really worried about misunderstanding and misinterpretation of facts. And he told us communication is key. It is so important. He also said, and I quote, sir, there's lots of quotes here, health learn from issues and complaints, and that they listen actively from things that are said from their patients. But sir, one of the reasons of my concern is over the last 2 weeks I've received a number of emails, and one jumped out at me when I listened to the Minister talking about learning from issues and complaints, when my parishioner tells me after 2 emails the hospital has completely shut down communication with us. Even the Minister himself, after responding once, has not responded again to numerous emails. So I'm concerned, sir. So we all have to live with COVID. We've all had to live with COVID, and some of us, frontline health workers in particular, have had to cope with stresses and strains over and beyond their normal duty. But sir, it's disappointing that the Minister expects us to use this pandemic to try to explain away all the problems of Plemmore and to try to use COVID as a reason potentially not to go back to SAMRO. Sir, I should be delighted with the proposition and speech of my very good friend and political colleague, Senator Pallett, but I'm not. Sir, I'm upset, I'm shocked, depressed, embarrassed. Quite frankly, I'm at a bit of a loss as to know what to say. How have we allowed things in our health service to get to this state? Senator said in his opening speech that national guidelines on rehabilitation are not being followed, and I, sir, know that there's been a denial by officers in other departments that there are actually guidelines to follow. And I know that's not the case because patients have told me that they're finding out after operations the protocols are in place but are not being used or followed. Just as a small, and it is quite a minor case, if you like, where stitches being taken out 5 weeks after operations. Well, I know the guidelines say that should be 10 to 14 days. I'm not going to talk about mental health, sir, but I know firsthand, very personally, the difficulties that mental health staff are facing at the moment. But I just want to return, if I can, quickly to the speech of the Constable of St John and another email that I've received from someone high up in the provision of help for stroke patients, and I quote from this letter: "We are losing huge numbers of staff occupational therapists and physiotherapists in particular, and stroke survivors are not getting the help they need. Sir, as I said at the outset, I'm worried and concerned that in his closing of the remarks, the Minister gave me the impression he intends to carry on as if he will go from here and pretend that we debated his amendment and he's won it. I believe that in the way he phrased his email last night, that he's found a way through the words of the Senator's proposition to carry on doing what he wants to do and not what is in the spirit of the Senator's proposition. So I urge the Minister, sir, to go back to Samurai, physically go back to Samurai, that facility where young Harry Zambon received so much good treatment in a dedicated facility, and to go, as the Minister said in his own words, to somewhere where he has space and facilities and somewhere where he can provide, and again I quote, the best and safe care. I ask the Minister to accept and acknowledge that he has a problem, a significant problem inside his department, and I ask him to take the first of what I think are very many steps that he will need to take, and to get on immediately and reinstate the rehabilitation centre at Samurai Ward itself. Thank you, sir.
Thank you very much, Deputy Martin. Does any other member wish to speak on the proposition? Senator Farnham.
Thank you, sir. And I will be brief, sir, in the context of the debate. And I really just wanted to provide some reassurance to members in relation to paragraph B, sir, and start by saying that, you know, it's recognised that every medical condition, especially every serious medical condition, requires rehabilitation. The very best rehabilitation services and facilities that we can provide at any one time, whether it be now, next week, next month in the new hospital. And that's what we always have to aspire to, sir, for every islander who is in the treatment and recovery process. So that's why I want to just confirm, for the avoidance of doubt, that it is an absolute plan for there to be dedicated rehabilitation, a dedicated rehabilitation ward as part of the new hospital complex, sir, with more beds that were available at the previous at Samurai Ward at Overdale, sir. The dedicated ward, sir, would provide a setting with all of the amenities required, sir, whatever they may be at the time, dependent, of course, on how treatments and medicine evolves, but that is essential. For example, sir, it is planned that there will be a purpose-built gymnasium adjacent to the ward, sir, one of a number of such facilities in the new hospital. And there will be dedicated bespoke space on and adjacent to the ward, dedicated to aiding early mobilisation. There'll be day rooms to facilitate the mobilisation for activities and for communal meals and social contact. And so the new hospital sites, are unlike the current facility, will be set in an elevated and peaceful location with its own landscape, grounds and facilities, sir, which will be purpose-built for a number of uses, so including for mobilisation assistance and training, including wheelchair training, sir, outside. And there will also be bespoke outpatient facilities for therapy input, sir, as part of the rehabilitation process. So I just wanted to confirm that, sir, that is the plan. We are all behind that. We're behind and committed to building a new hospital that will far exceed any of the services we have now and have had in the past, sir. That's the aim, that's the intention, and that is the instruction of the political oversight group, sir. So I can also say that I believe every member of the Council of Ministers, and I believe every member of this Assembly want the same thing, sir, and that is a greatly improved service for rehabilitation, excuse me, to be provided, sir, as soon as we possibly can. The Health Minister and his team are committed to providing this in line with the aspirations of the proposition, sir, and we're all pleased to support it. And I know the health team will give it everything, sir, to achieve the desired outcome. Thank you.
Thank you, Senator. Colin Tarb of St Saviour.
Yes, sorry, and I won't keep anybody long. I know we all keep saying that, but I cannot believe that we are talking about what's going to happen in the new hospital. And I don't wish this remark to be flippant. And I had a friend who passed away because the stroke, so help wasn't there. But are we asking people to wait to have a stroke till we've got a new hospital? This debate we are having is for now, and we need something to be done now. What we have in a new hospital is years away. We need help now. We need Summerray Ward to be reinstated now. And if you had a stroke, you can know that the facilities are going to be there for you. Not, well, wait till we've got the new hospital and then you're going to have everything. It's going to be all whistles and bells. No, we need the whistles and bells now, sir. Not when we're possibly going to have a new hospital. I'm sorry, I'm very upset about these things. We're not debating the new hospital, we're debating Summerray Ward, which needs to be reinstated now.
So can I ask the Constable to actually read the proposition paragraph B? Thank you.
I'm sorry, no, there's no room for interjection on that basis. Points of clarification can be raised, other things if appropriate, but not political observations or anything of that nature. Deputy Southern.
Sure.
Thank you, sir, and I shall try and be brief, probably succeed. Just to start with, to reinforce the comments that have just been made about why we're talking about 2026, why we're talking the new hospital, a 30-bed unit with a gym next door to it and day rooms, etc., etc. Beware of ministers bearing gifts, please. The issue is one which is, I believe, is legitimately, you could label a crisis. It's now. It's not in 2026. We are in 2022, and we need some solution. What I heard from the minister, is an excellent speech praising the hard work and the dedication of all hospital workers, and who would not do that, but who singularly avoided addressing the question of what's going to happen from the end of March. I've heard no commitment, no firm commitment that something will happen then. I've heard no commitment to, let us say, restoring a 24-bed unit with specialist staff in recuperation and recovery. And I've heard that the therapist staff in particular, they've lost, I don't know what the number is, tens of staff. And that the team has been effectively broken up and spread elsewhere. That may have been a result of COVID or otherwise, but now is the time to reinstate that, I believe. Again, I haven't heard any firm commitment that that will be happening. And I believe that that's what we need. It seems to me that, once again, we have a skepticism amongst the public who feel that what's about to happen in health, in developing health services, that they haven't been told what's going on. So, for example, in the Jersey Care model, we're told that funding will follow the patient. Where's the patient going to be? Where's the treatment going to be? Because they're unlikely to be receiving speech therapy or physiotherapy or occupational therapy, because those teams actually, in effect, are being broken up. In some cases, I believe they are referring their clients to their private practice rather than to the hospital. The system is in, I would say, is in disarray. And I haven't heard from the assistant health ministers, but perhaps they could take the opportunity to clarify what way forward we're going and whether we'll see a 24-bed or a 30-bed unit in the near future, because that's what we need. I urge members to support this proposition.
Very much. Deputy, does any other member wish to speak on the proposition? No other member wishes to speak on the proposition. Senator Moore.
Thank you, sir. There have been many excellent speeches today, so I won't. I'll do my very best not to cover those points, but there is one additional point that I would like to add to the debate and put on record. Firstly, I would praise Senator Pallett for bringing this proposition, which is timely and of the greatest importance for the people that we are here to represent and to serve. And I think it's a very positive thing that despite the minister's email of late last night removing his amendment, it's very important that we have had this debate and had the opportunity to hear from the minister himself, although his speech was somewhat disappointing in that it seemed to simply trot out many of the lines prepared by officials and was tone deaf to the many clear points that have been made in the Assembly today, sir, about the lack of accountability, the lack of listening, and the sheer impossibility that the first-hand experiences that are being reiterated to us time and time again are not being taken into account and listened to by either the minister or his senior team. And well, they should be ashamed of themselves, to be quite frank, sir. So we are where we are. We have for many months and years endured claims that there are no staff shortages, for example, when there clearly are. We have heard claims that the staff survey, which showed clear pressures and issues within this particular department, yet we were told by officials that no, we shouldn't take that into account, and it really isn't as bad as it possibly is. But then let's just look at their simple thinking and whether they are being logical in the thought process. And we all know that there is currently a shortage of staff in many sectors within our community. So the simple idea that we should send patients in a serious condition home to receive treatment in their home, when perhaps some of them live on their own. I've had tales told to me, reported back to me, of people single people who've been sent home to a flat on the second floor of a property where there is no lift. How, sir, it can be expected for that person to recuperate, to rehabilitate, and even to manage with the basic necessities of life in those circumstances is absolutely beyond me. Many families have contacted us with grave concerns about the cost of providing private care to their loved ones within the home. As I said, there is a very well-known shortage of staff, and therefore this act of moving people out into the community, whether or not it was based on a sound principle, is simply flawed, because it cannot practically be delivered. There aren't the people there to look after the patients, and therefore this is placing a greater pressure upon people who were already being cared for within their own homes by the private sector. So, sir, that was the main point that I wanted to make. But I also did want to just share a recollection of the excellent service that was provided and care for Anthony Lewis, who I clearly remember visiting him when he was moved into the independent living flat that adjoins the Samurai unit. That was a place where people would go to prepare themselves for returning home, to ensure that they felt comfortable and confident in returning to normal life and boiling the kettle, looking after themselves and their own property. And I think I remember so clearly that was a great point in the treatment plan, where you could see he was gaining in confidence and ready to make that move. And so that can only be a positive thing, and something that we should hope and expect for all of our patients. So yes, here as members, we of course have to take the advice of the experts, but we're also here to challenge that advice and to put a logical and practical perspective on that advice, because we're here to operate as lay people. And it simply just doesn't stack up that last week we received an open letter from the medical director and the chief nurse expressing very strong views about this proposition. And then last night we received an email from the health minister, in essence, capitulating. So what is it? What has changed exactly? And sadly, the minister did not provide us with that information in his speech. So hopefully somebody from the Council of Ministers will. Thank you, sir.
Thank you, Senator. Deputy Tellier.
Thank you, sir. Starting perhaps with that last point of the Senator Moore, we still do need some answers as to why this remarkable U-turn has happened overnight. Because the comments I thought were quite clear about not being able to accept the proposition for Samurai, and now we're being told actually it is okay, and it makes you wonder what is going on in the Council of Ministers, who they're being led by, if things can change so quickly in terms of their thinking. I've got a few thoughts on this. I'm sure, like other members, they have some direct or indirect personal experience with Overdale and Samurai ward. And I suppose the first point to make, just to overarch and contextualise what we're talking about, is to remind us that we live in a very wealthy island. We often hear words and phrases such as striving for excellence, leading the field in certain areas and punching above our weight. But when it comes to the provision of care for some of our most vulnerable, it seems that quite clearly what we've got here in terms of the provision at the moment, there is a lot of room for improvement. And the reason I think it is so important is that health is the great leveller. It doesn't matter whether you're a 21E in Jersey, or whether you're on a modest income or somewhere in the middle, that when you have a stroke, for example, as we're talking about today, which can, of course, vary in severity, it's nonetheless a great shock, and people realise that they need the system and they need somewhere where they can recuperate. And I have generally good memories of Samurai ward, as far as you can, because often you're going there to visit sick people who are recuperating, and it is something that I think is inextricably linked in my mind with what the definition of a convalescence area or home is, because it wasn't quite hospital. You'd remember going to see people in hospital when they had some kind of accident or incident when you were younger, and then you'd go and see them at Samurai Ward. And it was a bit nicer because you knew that, first of all, they were getting better and that's why they were there. They might have been undergoing some kind of physiotherapy. And it is a much more salubrious surroundings. It lends itself to the recuperation and convalescence because it's more spacious, it's at the top of a hill, it's green, and it just feels that it's a great place to recuperate. Perhaps, as one might have expected when it comes to mental health issues, back in its heyday, what St Saviour's Hospital might have been like. The idea of those two places I thought was very forward thinking. And that's why I think partly addressing the comments to part B of the proposition, which talk about maybe where in the future the stroke and rehabilitation services should be ultimately situated. Of course, we know the hospital will be going to Overdale anyway, so the issue of a convalescence area is not necessarily one that's a problem up there, because it can possibly go on the same site. But I'd like to make sure that it's something which isn't cramped, and that's somewhere where they do have space to not just physically recuperate, but psychologically have the space to breathe and also recuperate. It was really sad listening and reading through some of the case studies, and I'll only focus on one for the sake of brevity. And I noticed the comments that were made in case study 2 about Mrs. X, who suffered a stroke, serious stroke in 2020, and who had their rehabilitation on Plemmer Ward. And the stark words that were said there, that the family do not believe that she has had the level of care that she would have received on Samurai Ward had it remained open. And Mrs. X has now been home for 9 months and is still unable to walk or even stand up. And you look at also the fact that she was encouraged to get private physiotherapy for 2-hour, 1-hour sessions a week. And of course, all that really adds up, sir. And I don't think what we were being told initially when the proposition was being opposed and amended, that it's some kind of binary choice between physical provision of a place for them now up at Samurai or actually getting care in the community. And I think it has to be said, yes, we do expect good quality care in the community, but that can't come at the cost of other facilities which need to be permanent and physical in their location. I've adopted a stance when I judge whether or not healthcare is being delivered correctly, and whether it's for a family member or a constituent or just generally for the public, sir. And I say, how would the Queen be treated if she were receiving this care? And does it match with what I would expect her or the royalty to be given? And that's because I think that we should have the same level of service for everyone in our island, which should be an excellent level of service. And unfortunately, despite the best efforts of ward staff generally, that's often not what we get. And you do have to ask why these kind of propositions are necessary. I very much commend Senator Pallett and the Constable of St John's and others who have taken an active role in this area of bringing it to the fore. But so many things surrounding the provision of facilities which are tangential to the new hospital seem to have been just an afterthought. I mean, one question I would ask is, was the old Lekenaway school site ever considered as an appropriate place for moving convalescence and the stroke unit? I'm not saying that it should have, but we know that a lot of services were put down there as an afterthought at great expense, it has to be said, in an area which previously had never hosted a hospital type facility. But it seems to me that we do need to give consideration about where we put that kind of convalescence facility in the future, because it might not be best placed to be attached to an existing hospital. It might be best to be placed somewhere where it is green and where you have nature and you can hear the birds talking or singing, sir. And that would certainly be the case at the old Lekennebay school site. So I'd like to add that into the mix at this point, sir, rather than having high density housing going at that site. And I believe the residents of Lekennebay and Clos des Arbres have already had their fair share of dense population and property there. It could be an appropriate site for this new facility to be built, sir. I look forward to that being put as one of the options. Sir, I do hope now that this proposal in its current form will be passed. And once again, I do salute not just the good work of Senator Pallett and the others, but all of the staff who work at Samaray and at the current facility when they've moved, because they do an excellent job, I believe, under very difficult conditions. And I'd like to thank them personally for the care that they've given to my family members in the past during their time of need.
Very much. Does any other member wish to speak on the proposition? Deputy Young.
Thank you, sir. I was thinking whether to speak or not, but in view of Senator Moore's challenge, if you like, I think I would like to say a few things. I think I'd like to begin by praising the Minister's sincerity. I certainly was impressed with the genuineness of his emotion as he spoke and expressing his feelings as how life must have been. To have sole political responsibility at the time of the pandemic and successive waves, and the responsibility for thousands of staff and their health and their community on the shoulders of one person. And so I really empathise with him, and in doing so I have worked with our health service in a past life for several years. I think I understand how the culture was then, but of course the culture is changing. And I want to say a few words about that at the moment. But nonetheless, we all want the best health service for our community. And I think this is the real strong point that's coming from this debate. I think that we are on a journey in reshaping our health service. And so lots of reasons for that, changing in clinical solutions, science, best practice, and indeed our ageing community, and the fact that diseases, many things which could not be treated now can be. And the expectations of the public massively has grown. And I think that puts major pressures on us all. And I think I have made it quite plain to the Minister from the start of this debate that I would certainly, when the proposition came from Senator Pallett, that I would be supporting it. I've been plain about that to him, which he respected my views, but asked me to be open and listen to the arguments that came forward later, which I agreed to do. But nonetheless, my starting point is the support of the proposition, and I've never wavered for that. But like other members, I have knowledge of two people, different circumstances. I won't go into further on their individual, but both of them, for different reasons, were in a situation where, after very, very serious illness, they needed to have long rehabilitation. And I'm pleased, and they had that at Samaray Ward. And the reports I've heard from them, and what one sees as results, is that they have been returned, their quality of life has been massively recovered. And I thank the dedicated team at Samaray for doing it. I've absolutely no doubt that service is hugely expensive. That to me is recognising exactly what I'm saying, that as our health service develops in the future, we have to face up to the challenge that the cost of running our health service is going to grow and grow. And today the issues are rehabilitations. Tomorrow it will probably be other needs. And we must, I think, in the future, and I won't be in the States Assembly, I've made up my mind, everybody know that, to address this in the future funding. And that is why when I saw that this closure of the Samurai ward appeared in a statement of savings, I can't remember where it was, I was really shocked that that would be put through as, you know, frankly, to boast to that. I was really shocked. I'm frankly angry. I don't know whether that was a mistake or what, but nonetheless, I made it plain to the minister at the time that I did not buy in to this cost-saving efficiency agenda. None of us want waste, but the principal need is to deliver the best quality healthcare. And I hope that that lesson has been picked up from this experience. And of course, that links into the new hospital. We will need to make sure that we have the staff to run that, sufficient staff, and we need to pay the staff well to recruit them, and we need to be able to manage it and look after it and maintain it properly and not be cheese pairing. Those things need to be faced, and as the States moves forward, I think that needs to be very strong in people's minds. But anyway, I did listen to the arguments of the clinicians, and I respect their professionalism. But I think they were taking a very, I think they obviously had to take an overview of things, and but I personally don't understand why the facilities weren't resumed. I understand why the service was closed, but like others, I have that question, why wasn't it put back? But of course, in my view, if we are to have the new hospital on that site, and that's a story for another day, clearly the facility won't be able to go there, back in Samurai ward as it is in the meantime, in anywhere near the long term, other than for a short term measure. So that would need to be addressed, and I'm looking forward to the minister making that statement and tell me how he's going to deal with the interim, because we've got that commitment that the new hospital will include those facilities, and I was very, very, very pleased about that. But I think this issue about as we make our cultural reshape the health service, because it does need to reshape. Not only we should be looking at what was they called? The numbers, the statistics, the rationale. There should be a space to recognise we're a small island community where people matter. We aren't the giant NHS. We are not copying the NHS model. We're trying to pick the good bits from it, but one which meets our island community, because we've only got one hospital. And we need to provide for our community, and frankly, we can afford it. But the culture, I am really worried about this culture where people feel that they cannot speak. And one of the things that made me, and I was asked, well, why did I attend what happened last night? Well, all I can say, I attended the Council of Ministers meeting, and I maintained my arguments as to why I think the amendment did not work. I wasn't party to the amendment in the first place, not the wording of it, but I think locking it into futures, I did not buy into. But the biggest thing that happened yesterday, was Bailiwick Express that included 2 whistleblowing accounts. One was clearly from a senior medic and the other from a senior nurse, telling us as it is. And they obviously asked for their names to be withheld. And that really worries me hugely, that we need to, I really believe the culture needs to be adjusted to allow openness for staff to express their views in a constructive manner without being disciplined or subjected to any criticism. That really has to change. I put that right at the top. And I have to be also time that we stop polishing the facts and say how it is. And so I'm deeply worried. I really do want to know how it was that we've got one account saying there was a serious staff crisis, and then a statement officially saying there isn't. Those sort of things really undermine our confidence, the whole society's confidence. So no more spin. Tell it as it is. And to be honest, now I think Richard made a good start today. Sorry, Deputy Renouf. I praise his sincerity.
Actually, the Deputy of St. Warren.
Sorry, sir, the Deputy of St. Warren. I want to praise his genuineness. I don't think any of us would want to carry the whole load you've got as one political person. Members will probably know that I believe that we should have a broader based team of politicians, because the range of things in the health service is just too big. Acute, community health, mental health, community, everything, the whole range of stuff is far too big for one politician to carry on their own. But nonetheless, I've made my point, sir. So obviously I am really pleased, and I think I praise my colleague ministers that they were persuaded. They were persuaded that if you like, a mistake, I believe, had been made, and that the best thing to do was to hands up and say so. And I praise the minister and I praise my colleagues for that, which I hope they will all now support this, because I think this is a cathartic moment where we face the realities of running our health service, which is a very, very tough in any community, but for us really hard, and learn the lessons and make sure from now forward in reshaping towards a Jersey care model and the way we run things, that we make those directions of travel and have, for example, a much more open approach to governance and how we structure our patient arrangements in terms of user groups, or whatever you want to call it, patient groups. Thank you, sir. Thank you very much, sir.
Thank you very much. Does any other member wish to speak on the proposition? Chief Minister.
Thanks, sir. I think, like many members, I've been listening to the debate with great interest. And again, sir, I want to be very clear at the outset of my speech to reiterate the words of the Health Minister in apologising to those patients and staff who've been affected because we've not delivered the level of service that we aspire to do. But let's also be clear and just remind members again that the reason that the unit was moved away from Samaray was because of the COVID pandemic. It was at the time that we were forecasting around 500 people could die and many people would be in hospital. Members may recall that there's a great deal of focus at that time on the level of beds that would be available should this occur. And this was, of course, also the rationale behind the Nightingale Hospital as well. It was also about making sure we made the best use of our dedicated staff, recognising that their numbers are finite. And the advice was therefore that we brought as many staff into the General Hospital as possible from this perspective. This then allows for staff absences, for example, from illness, to be met more easily, adding flexibility and resilience to our pandemic response and helping to ensure that our health service was not overwhelmed. And also to be clear, it was not about saving money. That was a consequence of the decision. It wasn't a cause of the decision, and that's really important, sir. So to date, whilst there have been pressures, the health service has not been overwhelmed. However, the considerations of maintaining staff presence are as valid today as they were in the past, given that we are still in a pandemic and there is still a risk of further variants and further peaks. Also, we hope, sir, that we are coming out of it, and at the moment it looks good, sir, but we are not fully out yet. So it is for this reason, sir, that we need to keep this resilience baked into our healthcare response to ensure that we can quickly and safely react to future waves and cases. That also is why when we're dealing with incredibly challenging and sometimes incredibly emotional issues, we have to remember we need to deal with them rationally rather than just from the heart. And so, sir, an implication, for example, that everyone who's been treated on Plemor has suffered is incorrect. What does that say to the staff who are looking after patients on that ward who are broadly the same as those who are treating patients at Summerey? I will come back to some other remarks later, but this is of course an important and also an emotive issue, as Senator Pallett said in his opening remarks. Many islanders have fond memories of Summerey Ward, and as the Health Minister acknowledged, we apologise for the lower standard of care, for a lower standard of care than we aspire to. But let's also be clear, I believe that we are all in vehement agreement with one another that we should be providing the best possible rehabilitation services to islanders. And that's why council ministers have spent a great deal of time in recent days, including a meeting last night, to discuss this proposition and consider how we can deliver its ultimate objectives, which is the provision of good rehabilitation services to islanders. Now, this proposition, sir, which the council minister now accepts unamended, calls for the health minister to reinstate the high standards of care that patients deserve. Now, that's something, sir, we are fully committed to delivering. The health minister will be ensuring that the provision of rehabilitation services is restored to those high standards that patients deserve, and will do so in a suitable location, guided by the best clinical and medical advice, just as we have throughout the pandemic. And it is very important, sir, that medical operational decisions are guided by medical advice and not just by political opinion. Now, there are, sir, important and necessary improvements that are needed across our health service. We know that this is an area that's not had the processes and standards needed, and has not been swift in adopting international best practice of medical science has advanced. And so, therefore, rehabilitation is one such area where best practice has advanced, and where Jersey must catch up to ensure patients are provided with the best care model. And so, I'm reminded, actually, sir, of in a completely different sphere, a presentation we gave to States members back in 2019, which I would suggest was a warts and all, around various areas, whether it was culture, whether it was IT, whether it was HR issues and others. And we did lay on the lines there the issues that we were facing. Part of the problem one has when one is trying to change an organisation and a culture within the organisation is that there are sometimes people in there who very much look back with rose-tinted glasses sometimes to what they regarded as better times, when of course their life was a lot less challenging, i.e. they weren't being challenged with the change that this organisation does need across many, many places to bring it into the 21st century. I think we've got to remember that sometimes, sir. Reference has been made, for example, sir, to the Jersey Care model. It's now entering its second year. It is beginning to make the improvements that we have been seeking, but don't forget, it is a 5-year programme of change, and there are many improvements still to come. But for example, so there was a question as to what it has delivered so far. I would like to give just 2 or 3 specific examples. But particularly, for example, we've now established a stroke consultant. That wasn't there before. Overnight community care service launched last April. It provides patients with home-based treatments when it is safe to do so. So, for an example, so might be if somebody needed a catheter changing out of hours. Previously, they might have had to go into hospital and potentially stay overnight. Now they will receive a visit at home, out of hours. It can be changed, and then they can go back to bed in their own home. And that's being done, sir, through family nursing and home care. And that's being, as we said, the overnight community care service launched last April. There's the HCS 24, a hotline, sir, for islanders, their carers and their GPs, which was launched at the end of November last year, provides a one-stop shop referring patients directly to treatments, therapies and support. We have and we continue to intensify community provision of physio and occupational therapy. In spring last year, we rolled out a digital app, My M Health, which supports more than 500 islanders to manage their long-term conditions, provides a link to respiratory, cardiac and diabetes community teams. As I said, that's all since the beginning of last year, and we're now starting year 2 of the Joseph Care model. 2 examples of what to come are as follows. One is a night sitting servicer that will be enabling patients to return or remain in their own homes during periods of convalescence, preventing unnecessary hospital care home admissions. And that's going to be provided through and with community partners. And a care reablement team, sir, which is going to work closely with the discharge support team, and is basically a 24/7 multi-professional advanced nursing care and therapy service, providing care in patients' homes following discharge from hospital. And also, sir, just to address the present use of Samurai. Samurai is presently occupied, sir, by a number of services following the displacement as a result of the HCS response to COVID. Now, these are all due, sir, to move to the form of the Canterbury School at the moment, sir, during this year. And that's is pre-assessment, retinal screening, the Fit for Life service, neurology, the assisted reproductive service, and community therapies. These are all using that building, sir. That's around 50 staff. And yes, whilst they are technically classified as members of the civil service for the purposes of salary, they are all healthcare professionals. Now let's just try and look forward, sir. The HCS team will work properly with patients, families and colleagues to improve the service. There is a comprehensive improvement programme in operation. It's being led by the chief nurse and the director of improvement, and all options are being considered. So when we asked what they needed, they were very clear, or the team was very clear. They said time and space. And that's time to focus on getting improvements in place, sir. So Senator Pallett rounded up his opening speech by stating that the move back to Samurai was operationally possible, clinically safe, and the staff from Plymouth wanted to go back. Now, in my view, sir, we have to be very careful as politicians, generally without an expertise in the subject we are debating, about making pronouncements which cut across professional, clinical, or legal responsibilities. Now, that may have been Senator Pallett's opinion, but it is not his operational responsibility, and he does not carry the legal responsibility if things go wrong. What I can say is that certainly I'm informed that what he said about staff is incorrect and actually to the contrary. And that is the problem of part of this debate. It is based on anecdote and opinion, whereas we do need evidence. What I can say, sir, is in the last year, Plymouth has treated 335 patients, and I understand 7 complaints have been received. Now, we accept that improvements need to be made. We apologise, sir, for the, as I've said earlier, for the deficits one likes, or the fact the level of care did not aspire to the level we would all expect. But so we accept the improvements need to be made, and that is the intention of all parties involved on this. Sir, I can also say, sir, that I don't think, sir, that it is appropriate to comment that HCS is not working in many, many areas. And I think I do want to push back on that, sir. We have come through, or we are coming through, hopefully the end of the pandemic. And thus far, sir, I think we've come through well. We have protected lives, and actually waiting lists are almost down to pre-pandemic levels. So there are obviously some areas that need attention, we know that. The wholesale condemnation of the system is just not appropriate. So in summary, sir, I will be obviously voting in favour of this proposition. That was the conclusion of the Council's discussions last night. But I will also, sir, and I hope the Assembly does, be giving the Health Minister my full support as we work to improve rehabilitation services for islanders. And that has got to be our focus, and we must enable our health and medical teams to do their jobs and focus on delivering the services that we want them to deliver to islanders. Thank you, sir.
Thank you very much, Chief Minister. Does any other member wish to speak on the proposition? Point of clarification, Chief Minister, do you give way for a point of clarification?
Oops, I will attempt to, sir.
Yes, Deputy Ward.
Thank you, sir. And I thank the Chief Minister. I know it's been a long day. Can I just confirm with the Chief Minister that Part A, he is supportive of the re-establishment of the rehabilitation centre at Samurai Ward?
Sir, I don't think I can say any more. What we have said, we've considered the wording very carefully in Part A. I've said, in fact, I'll just return to the relevant part of my speech, sir, which is that the Health Minister will be ensuring that the provision of rehabilitation services is restored to those high standards that patients deserve, and will do so in a suitable location, sir, which is what the Part A says, guided by the best clinical and medical advice, just as we have throughout the pandemic, sir. And that is all I can say, sir. That is basically the meaning, sir, of the Part A of the proposition.
Very well. Does any other member wish to speak on the proposition? No other member wishes to speak? Then I close the debate and call upon Senator Pallett to respond.
Thank you, sir. And first of all, I want to thank everybody who's spoken in this debate. It's been emotive. It's been, I think, there's some very good points being made virtually in every speech. In many ways, I'm almost tempted to go straight to the vote because I'm not sure there's anything to be gained by going over a lot of what's been said. But I will. To be fair to those that have spoken, I think it's right that I do. I just very briefly, I want to thank Senator Ferguson for her comments. She's absolutely right. I think it's appropriate for the Health Minister to apologise, and bullying is clearly an issue. She's right about Jam tomorrow, and people should be held to account for the decisions that they've made. Constable Sir Mary made an important point about the planning brief for the new unit, and I know Senator Farnham has mentioned what will be potentially within the new hospital, but we do need to do that, and we do need to know what a potential site might be for an alternative to Samaray once it is removed. And he did mention the Kenneth School, and so did Deputy Tadier, and maybe that's something that does need to be considered. Again, I want to thank Deputy Gardner for her comments. She's quite right. I think sometimes these debates are beginning to deteriorate somewhat when they end up in the internet and on the internet and the media. But this was an issue, I think, that the public had very strong views about. I don't think it was particularly driven by the internet and the media. I think it's been driven by the public. I think the public are extremely disappointed at of the service that's been offered over a period of time, and I think have spoken. They're quite clear about what they want, and that's the service to be re-established at Samaray. Again, you know, she's right. We are the voice of patients. That's our job, and that's something that I think we've got every right to do. Deputy St John, sorry, the Constable of St John. I could hear the emotion in his voice, and I've spoken to him a great deal about this. And I know from he's got personal experiences that are very, very close to home. But he made so many good points about what's gone wrong, some of the issues that need to be rectified, he's absolutely right in some of the points he made about the environment for an inpatient rehab unit. It does need to be somewhere where you can recuperate, you can rest, you can think, you can start to rebuild your life, and that's clearly not possible in our view in a busy acute medical ward in the hospital. And I hope members appreciate that and realise that. There is a fear, and I know the Chief Minister's just mentioned it about he doesn't believe that it's the staff's view that they would like to go back to Samaray. Well, we don't know because they're too scared to speak. They're fearful of speaking out. And again, I'll go back to the video. Why don't we have the staff actually speaking openly about what they feel is right moving forward? It didn't say that, and I think that's something that was sorely missing from this debate, is what the staff actually think. But I thank the constable, because everything he said was heartfelt, and it is important that we listen and hear what he was saying. Deputy someone, the minister, there is a denial of, there seems to be a denial of some of what's gone on. And I don't really know why. He says it's a learning organisation, but for me, the learning's been far too slow. It's issues have been arising for some period of time. The Constable of John himself said that even the early part of the summer last year, he was making comments as to some of the issues that were carrying on, and they've been ignored. It isn't about staff. I know he spoke at great length about what the trials and the tribulations of staff over the last 2 or 3 years with COVID. We all feel for the staff. Nowhere in anything I've said or written have I said that staff are to blame or pointed the fingers at staff. I think they're in a very difficult position. They've had to work extremely hard in some very difficult circumstances. But in saying that, and I'll say this to the Chief Minister as well, you can't blame COVID for the whole of the 87 weeks since the ward was moved to Claremont. There have been periods when there's have opportunities to reassess whether the unit could have gone back to Samaray, and those opportunities have not been taken. Again, with staff, whether the care was given, they've been under pressure all the time through this pandemic. We accept that, but whether the care being given to rehab patients was given at Samaray or given at Claremont, the fact is they still would have had to give that care. In fact, in some ways, it might have been safer for patients to be at Samaray. So that the hospital did have more resilience in the hospital itself in terms of bed numbers, and the same is true at the moment. There's much that the Minister said that I think we've heard before in both his amendment reports and in the State's briefings. He doesn't agree with some of the comments that we've made, and certainly some comments that we've made around, or the different opinion about some of the comments that have been made about those that featured in the video, for example. But I think we'll just to agree to differ on some of those issues. Moving on to, sorry, I've got my notes here. Constable Samart, again, thank her for her support. She mentioned, and I'm going to mention this a couple of times now. She mentioned about the importance of reinstating Samaray ward. I'm beginning to read between the lines of what I'm beginning to hear now from the Minister and also from the Chief Minister, that they think there is some wriggle room, I think, within the wording to maybe not do what I think the will of the State is, presuming they pass this, and that's to reinstate the ward at Samaray. I want to mention the comments that Deputy Ward made. He was quite right. He concentrated, he focused on the wording, and it's something that I thought about for the last couple of days. When firstly, when I heard that an amendment is potentially going to be removed or dropped, as to why, and I am beginning to get fearful that. And I've heard the decisions will be made by clinicians. Decisions will, should not be in the political domain, that irrespective of how we vote, that the minister is not going to deliver or is not going to approve a return to Samurai. I really hope it's not the case. There is only 6 weeks to March the 1st. So we'll know pretty quickly whether there's any intention to go back. And I think it'll be a pretty poor show if we vote for this amendment, for this proposition, and we find out in 6 weeks' time that the minister's decided that his idea of a suitable location is Plemmoor Ward, when the evidence and the patient stories and all the other issues that we've highlighted today suggest differently. So to Deputy Ward, I would say to him, I will be keeping a very close eye on what goes on in the next few weeks and ensure that that the terms of this proposition are kept to. Going back to Deputy Wren, sorry, the Deputy Someone, I thank him for his offer to meet, and I will take him up on that, because I do want to understand how we're going to move forward. Because if it's not within the the feel of this proposition, then I think we're going to have some issues. And I also appreciate his offer to meet with Professor Massey Taylor. I think anything that that will move this forward, both in terms of short and long term, can only be beneficial. So I will take him up on that. Deputy Morell, again, I thank you for his comments. I think he was absolutely on the ball with some of the things he said, as normal, around acknowledging faults and poor communication. He mentioned the petition and the inability to accept the problems at the time, and taking far too long to accept there were problems. Absolutely. We do need to move on. We need to provide a better service. And he mentioned that the minister and his department are not listening. I hope they are listening, because the public, and I'm hoping states members today, are going to say, get on with re-establishing Samurai as a centre of excellence for rehabilitation.
Senator, will you give way for a point of clarification from the Deputy Sewell?
Happy to, sir.
Deputy.
Thank you, sir. The Senator has several times in his summing up has referred to moving services to the former Samurai ward. Is the Senator saying that his proposition means services can only be delivered in Samurai ward, or is he saying, in the words of the proposition, either at Samurai ward at Overdale or another suitable location as determined by the Minister? That's the clarification I'm seeking, sir. Thank you.
Well, I'm not actually sure that's a point of clarification for the Senator. In the circumstances, the Senator may have a preferred option, but the wording of the proposition is entirely clear. It is either at Samurai ward at Overdale or at another suitable location to be determined by the Minister. If there's a vote for that, that is what the opinion the states would have expressed. So I'm not sure it's a point of clarification from the Senator. It's an interpretation of the wording of the proposition. I hope that assists you, Deputy.
Yes, it does. Thank you, sir.
Very well. Senator, if you would continue. Yeah.
Yes, I will, and I thank you for your clarification, sir. Again, thank you, Deputy Sir Martins, for his support. He picks up on an important point, something that others, including Senator Moore's, picked up on, and that's about the loss of staff, and that has been extremely worrying. And it's important that we do stabilise staff and recruitment and retention over as we move forward. Senator Farnham, again, I thank him for his clarification. It is comforting that that the that the design team are looking at how they are going to provide rehabilitation services at the new hospital. So I thank him for that, but it is important that it really is a proper dedicated unit, and it's not just part of a number of acute general wards in a hospital. That it is dedicated purely to rehabilitation and staffed as such. Interestingly, the Constable of St Saviour's, I think, hit the nail on the head by really quite simply saying Santa Maria ward now. And I just going back to that, I think concentrating on that point. No, I think the proposition is clear about Santa Maria ward or another suitable location. But I think the proposition is clearly aimed at Santa Maria ward, unless that's not available, and another suitable location in my mind would not be Plemmoor ward. So I think maybe that might give some idea to the minister about my thinking. And again, I thank Senator Moore for her comments. I think mentioning that the department's been tone deaf in regards to accountability is absolutely right. And treatment at home, which I think is a really important point. I'm not convinced we're where we need to be. I still think there's a clear lack of assessment of people before they are pushed back into their home environment. And I really do worry where some have had that ability to manage. Deputy Stadier picks up on an important point, as Deputy Ward did, around why the U-turn. Again, I'll be looking very closely about how this proposition is delivered, and I will be looking to for the minister to listen to what people have said today, and listen to what the public have said. And yes, he has to listen to his clinical team, but I think he also needs to understand that the public do have the right to say, and states members do have the right to comment on a service that hasn't been what it needs to be. Whilst a rehabilitation unit, whether you are using it for a resilience reason or not, could have been reopened sooner. Deputy Young, I agree with Deputy Young. I work with the minister. I don't doubt his sincerity. He does care for people. I know he does. I don't always agree with the decisions he's made, but again, I think he makes them because he believes in them. But I think when mistakes have been made and improvements need to be made, they need to be made quicker, and I'm not sure the department's acted quick enough. He mentioned the £1.8 million savings and was shocked by that, and rightly so, because I think we all are. If that's to see 1.8 million savings against a service such as this, and in fact those services, as we know, those savings have not been made. The cost of running both Samurai and Plemmoor are relatively similar. But he also picks up on the opportunity for staff to whistleblow, and he's right, it is the top issue. Any organisation should have an opportunity for their staff to be able to speak openly if they're not happy about something, and that clearly doesn't exist at the current time, and that needs to improve. Finally, the Chief Minister, he's got a difficult job. I don't deny he's got a difficult job, as the Health Minister's got a difficult job, and COVID has been a very difficult time and very difficult to manage. But nevertheless, situations have changed during that period of time. Yes, pandemic is still with us, but there are times when we've certainly had quite the times when really I think we should have assessed whether Samurai could have been repurposed back to what it should have been its intended purpose, and I think we missed that opportunity. He mentioned that around how the decisions will be made, and look, that they will be clinical decisions. In my view, what that is saying is political opinion will be ignored, and I desperately hope that's not the case, and that the Minister will take into account the views of the Assembly and the views of the public in what they feel to be the right way forward. He mentioned the improvement plan. I've said it in my speech previously. It's needed, whether it's at Plemmoor or whether it's at Samurai. It certainly is needed, but it's in some ways too late. Some of the damage has been done. Yes, we've got to put that right, but we could have done that sooner. And again, he mentioned staff in his speech, and this proposition has never been aimed at in any way denigrating staff or suggesting staff are not doing their job. I think it was very much around trying to find the right solution in terms of facilities for rehabilitation service, and make sure we give staff the best opportunities to provide the best possible care. I think that's gone through all the members that have spoke. It's late in the day and it's almost 5:30. I think I'll finish there. I will just say though that I think the success of this proposition is not about winning the vote, because the vote won't mean anything unless it delivers what the proposition set out to do. And I think generally what most of us feel that means is a return to Samurai Ward in the short term. What is decided in terms of the interim before the new hospital is built, I think we can talk about that. But for me, it's about delivery, and it's about making sure that islanders get the best possible service as soon as possible. Having visited there the other day, I'm pretty convinced that that's difficult to do in Plemmoor Ward. So I ask members to support the proposition and hope the Minister, if it's successful, takes account of what he heard, what he's heard this afternoon, and does the right thing. Thank you, sir.
Very much, Senator. I ask the referee to put a voting link in the chat. Open the voting and ask members to vote.
So, oh, it has, sorry, thank you.
Members have the opportunity of casting their votes. Then I ask the greffier to close the voting. Opposition has been adopted, 41 votes for, no votes contra, no abstentions in the link, and a further 4 votes for noted in the chat. Very well. It's now past 5:30. Is the adjournment proposed? Well, the Assembly stands adjourned until 9:30 tomorrow morning.